Shubhayu, am I audible, madam? Hello, hello.
Yes, you are audible.
Okay. Shubhayu, good morning, everyone gathered here. First, I would like to welcome today's judges, Dr. Sanjay Kadlimatti sir and Dr. Shobha madam, for this wonderful presentation session. And I also welcome all the faculty members and Apta's team for this the online presentation of their faculty. With this brief welcome, I introduce the today's judges. First, I would like to introduce Dr. Sanjay Kadlimatti sir. Dr. Sanjay Kadlimatti sir, born on 1/8/1977 at Kumatagi village, Bagalkot district. Sir is working presently as the principal, PLD Ayurvedic Medical College and Research Center, Vijaypur. Sir completed his BAMS from the Ilkal Ayurvedic Medical College and post graduation from Ayurveda Mahavidyalaya Hubballi, and Sir completed his PhD from the one of the prestigious institute in India, that is IPGT Jamnagar, and Sir worked as a different the positions, and Sir is having the well experience in academic as well as the clinics, and Sir is a resource person for many of the seminars as well as the workshop, and Sir is a well known practitioner in his college as well as Karnataka. With this brief introduction, I welcome you, sir. And once again, I welcome Dr. Shobha Bhatt, madam. Madam is well-known personality in the field of Agada Tantra. Madam completed her BMS in renowned institute SDM College of Ayurveda, Udupi, and Madam completed his the post-graduation in the Department of Agada Tantra from Vaidyaratna PC Warrior Ayurvedic Medical College, Kottakal, Kerala. And Madam pursued her the PhD from Institute of Medical Sciences, Banaras Hindu University, Varanasi, and Madam currently working as the professor and HOD Department of Agada Tantra, Faculty of Ayurveda IMS BHU Varanasi. And Madam extensively working in the field of the research, the role of Agada and toxic drugs in different the cases of toxicity. And Madam having the different the publications more than 25 paper presentation, and Madam authored 2 books and 5 chapters in various textbooks. With this brief introduction, I welcome you, Madam. Once again, I welcome all the faculty members and the coordinator of this program as well as the moderator. Thank you for the opportunity. Over to you, Madam.
Thank you, sir. Before starting the session, we are briefly tells the rules and regulations. First one is the presentation are carried in the same order as previously noticed. Presenters must be ready with their presentation and must present in your turn. Time limit is 4 plus 2 minutes. Strictly added to the timings. If the time exceeds, the presenter will be muted. Participants who are presenting must switch on the audio and others must be on mute and avoid disturbances. Thank you.
Madam, will you take a note of the time or should we keep a note of this?
We will take the time. Now, I would like to welcome our first presentee, Dr. Kirti Rotti, Assistant Professor of Roganidana Evam Vikriti Vignana from College of Ashwini Ayurveda Medical College and PG Center, Davangere. Title of presentation is Interpretation of Dhatu Poshana Nyaya in the Management of Hair Disorder. Over to you, ma'am. Kindly share your PPT.
Yes, ma'am, I'm doing it. Share screen. Yeah. Hello.
Yes,
How
you're
to share
audible,
screen?
ma'am. You're audible.
Uh, Ma'am, my screen is audible.
Your screen is, yeah. Now it's coming.
One second. Is it visible, ma'am?
Yeah. You have to turn it, I think. It's vertical.
Okay. Have to turn the screen. Is it visible, ma'am?
Yeah, you can proceed.
I'm Dr. Kirti Rotti, Assistant Professor, Department of Roganidana from Ashwini Ayurvedic Medical College. My topic of presentation is interpretation of Dhatu Poshana Nyaya in the management of hair disorders. So these are the contents of my presentation. So firstly, Dhatu Poshana Nyaya. So it's a very basic concept in Ayurveda, as told. It's a process of transformation of nutrients which are absorbed in the blood after digestion of food, which is expressed as a Dhatu Poshana Nyaya. So there are totally 4 Nyayas told: Kshira Dadhi Nyaya, Kedari Kulya Nyaya, Khale Kapota Nyaya, and Ekakala Dhatu Poshana Nyaya. So here, so I'm going to choose 2 Nyayas here: Kedari Kulya Nyaya and Khale Kapota Nyaya. So Kedari Kulya Nyaya, according to this theory, the process of nourishment of tissues can be linked to irrigation of different fields by water from a canal. That is, dhatus are nourished by ahara rasa through specific dhatu vaha srotas or canal. This law indicates that rasa dhatu is nourished earlier than the mamsa dhatu, as it is nearer to the channel, and mamsa dhatu is farther away. So each dhatu is formed by poshaka amsha, which is obtained as an end product of transformation process of preceding dhatu. That is, we know from ahara rasa rasa, rakta from rasa, mamsa is from rakta, and so on. Here asti is obtained from medha dhatu. So interpreting this theory, what we have to do is to treat asti dhatu as kesha is mala of asti dhatu. We are going to treat asti dhatu here. All the preceding dhatu should be treated first. So all the pathological stages should be treated. Then coming to Khale Kapota Nyaya. So according to this theory, the process of nourishment of dhatus takes place by selection method. That is, Khale means field wherein grains are heaped after cutting the crop, and Kapota means pigeon. That is, selection of individual items of requirement by individual Dhatvagni from Mahara Rasa, which can contain all the nutrient principles. So interpreting this Nyaya, so what we have to do is we have to treat the target dhatu here. It is asti dhatu should be treated. We have to give drug for the asti dhatu, and kesha should be treated, and disease should be treated properly. So next, if you take the example of Khalitya, these are the dosha, dusha, and srotas involved in the manifestation of Khalitya Roga. So if you follow the Kedari Kulya Nyaya in the management of Khalitya disorder, we are going to treat stress mainly, as it is the main cause in the manifestation of almost all the trichological disorders. Then we are going to do Pitta Shamana, as Pitta dosha is a very important dosha involved. Then Dipana Pachana, removal of toxins of free radicals. That is Ama Pachana should be done. Correction of Rasadhatu, lymphatic drainage. Correction of Rakta Dhatu, improving the blood circulation to the hair follicle, which improves the hair growth. And liver tonic should be given, that is Yakrit Uttejana Dravya should be given, that is micro and macronutrients to the hair follicles should be provided. Mamsa Poshan, erector pili muscle strengthening treatment. Meda Dhatu Chikitsa, sebaceous gland should be nourishment, that is nourishment to the hair follicle, equal distribution to the hair follicle of sebum. Asti Poshana, micro and macronutrients to the bone, and Shukra Dhatu should also be treated so that we can maintain the testosterone, LH, prolactin, estrogen hormone to maintain the hair cycle and nourish the hair follicle. So if we follow the Khale Kapota Nyaya, so one Sthanika Chikitsa should be done, that is Shiro Abhyanga, Shiro Pichu with a Bhringamlakyadi Taila here in Khalitya. Talam with a paste of Shita Virya Dravya like Yashtimadu, Manjishta, Sariva, Rakta Chandana, Ushira, Kumari, which can be prepared with an Arikela Jala. Kesha Dhupana can be done with Gomaya, Triphala, and Yashtimadu Churna. Kesha Prakshalana can be done with the preparation of shampoo or simply with the Kashaya of Yashtimadu, Triphala, Amalaki, Musta. And Asti Poshana Dravya Prayoga should be done. And Panchakarma Chikitsa can be followed here. So Chikitsa Sutra, by following these two Nyayas, by interpreting these Nyayas. So first phase we are going to do with the Pitta Shamana, Amma Pachana, Vatanulomana. And second phase we are starting with the Rasa Shodhana, Rakta Shodhana and Prasadana. Third phase we are doing the Yakrit Uttejana, Mamsa Brahmana and Medo Pachana. Fourth phase Asti Poshana. Fifth Kesha Poshana. And then sixthly we are going to do is Rasayana. So each phase should be given a proper duration. Periodic treatment should be done. And following Koshta, Srotas and Dhatu Chikitsa, that is Sadhya Virechana followed by Nitya Virechana. Srotas to treat the Rasa and Rakta, we can go with the Pariseka, Kashaya Dhara, Sarvanga Abhyanga. Dhatu for mainly we have to concentrate on Basti, mainly Tiktaka Kshira Basti. So next we have administration of herbs and management of hair, interpreting these two Nyayas. So these are the few drugs I have chosen, like in Koshta, Rasa, Rakta, Mamsa, Meda, Asti, Majja and Shukra and Manas. So these are the few drugs which can be followed in the management of hair disorders. So totally what we can conclude is, as health is a state of complete physical, mental, social well-being, not merely the absence of disease. So trichology, dermatology and cosmetology have an impact on especially social and emotional well-being, especially in the youngsters. So this cannot be neglected. We have to concentrate on the management. So this process is time consuming. We know that because we have to follow each phase properly by giving proper time. But this phase, if you follow, this principle, if you follow, it has a low rate of reoccurrence, and treatment of the diseases can be from its root cause, and treatment can be done for all the pathological stages involved in the manifestation of diseases. Unlike other science, modern science, which gives only symptomatic relief, like if you know most of the conditions, they are like reoccur after withdrawal of treatment in most of the modern science. So lastly, what we can say is bone and hair have interrelationship. So because osteoclast cross section is similar to, it looks like a hair, and hair fall is a symptom of almost all the bone and joint diseases. So Ayurveda obviously says Kesha is mala of Asti Dhatu. So one set of treatment should be targeted to Asti Dhatu and hair, like example I told in Khalitya, and one set of treatment we have to follow Kedari Kulyana. So one following Khale Kapota Nyaya directly to a Asti Dhatu and disease or hair, and one set of treatment following Kedari Kulyana, that is to
Thank you, Dr. Kirti. Judges, over to you for further questions.
Dr. Kirti, have you treated any patient, clinical experience with such? Hello. Dr. Kirti, am I audible?
hello.
Yes, Dr. Kirti, am I audible?
Yes, ma'am, you're audible.
Yeah. Do you have any clinical experience treating these patients with all these methodologies you have said?
Yes, ma'am. Yes, I have just begun my treatment. I'm not experienced one, but I have started when I have started this treatment principle, ma'am. It is actually time consuming, but it is really having a good results because it treats from root cause. As we all say in Ayurveda, we treat from root cause. This is actual methodology to be followed,
There are
ma'am. Not only
many
here.
other causes. Yeah, I get your point. There are many other causes which have not been considered by you. What about them? Like infective causes, maybe, or
Ma'am, I have just told one example here, Khalitya. So rest of the like we are going to start from Koshta. So Koshta, then Srotas, and then Dhatu. So there, even infections can also be treated there, ma'am.
directly with Costa. Even in case of infections, we will start with Costa.
Depending upon the pathology, we can treat the diseases, ma'am. But it's better to follow these proper steps.
What is your ideology regarding the ready availability of the drugs becomes an important issue. So you have named only one Neeli Brangamalaki Taila, and all the rest are single drug that you have mentioned in your presentation. So whether these are available in the market for patient, won't it be difficult?
Ma'am, we can use it in the form of like for Koshta, we can use in Vati, Guti form, like based on the prayoga of the Aushadhi, ma'am. So they are available. Various formulations are available, ma'am. I've just told the example of herbs which can be selected.
Name some formulations that are available. That must have been included in your. That would have been better. Can you name some?
Ma'am, for rasa, Amrita Rishta can be given for rasa chikitsa. Rakta Manjishtadi Kashaya. For Mamsa Bala combination like Bala Rishta can be given. Mainly Asav and Arishta can be followed in the treatment which have more assimilation effects compared to other.
According to
Hello?
your Nyaya, after one dhatu, you will be targeting the next, isn't it? You cannot target everything together.
Yes, ma'am. Like I told, phases I have told, ma'am. First phase,
Yeah.
second phase, third phase. Yeah. So in that
So how?
way, you can.
Okay. Okay. Fine. Thank you.
Thank you, ma'am.
Thank you, judges. Thank you, Dr. Kirti. Now
Thank you.
moving on to the next presenter, Dr. Maheshwari BH, Assistant Professor of Agada Tantra, Jain AGM Ayurvedic Medical College and Hospital, Varur, Hubli, Karnataka. Title of presentation is Critical Review on Utility of Agada Yogas in Managing Tvak Vikara. Over to you, Dr. Maheshwari.
Good morning, everyone. Is it my screen is better visible?
Yes.
Can I start now?
You can start, Dr. Maheshwari.
No. Okay. Thank you. Good morning, everyone. Myself, Maheshwari, Assistant Professor, Department of Agatantra from JNAGM Ayurvedic Medical College, Varur, Hubli. Today, I am presenting on the topic titled as Critical Review on Utility of Agada Yogas in Managing Takvikara. These are the contents of my topic. Coming to the introduction. Pashana Katina Parusha Supte Kushte Stire Purane Cha Pita Agadasya Karyo Vishay Pradeho Agadaye Cha Anu. When Kushta is having symptoms like Pashanavat Katina, Parusha, Suptata, and Kushta, which is Purana, in that condition, Acharya Charaka advised to use Agada Yogas. So, this review aims to evaluate the utility of Agada Yogas in the management of Takvikara. Next comes to the aims and objectives. It is to assess the efficacy of Agada Yogas in treating different types of Takvikara and to analyze the mechanism through which Agada Yogas exert their effects on skin disorders, and to review and compile clinical evidence and case studies supporting the use of Agada Yogas in contemporary practice. Materials and methods. The review employed a comprehensive literature search including classical Ayurvedic texts, peer-reviewed journals, and clinical studies focusing on Agada Yogas and their application in Takvikara. Understanding the Takvikara, in Ayurveda, skin disease have been dealt under the heading of Kushta, and all types of Kushta have been considered Aktavaha, Shroto Dushti, Janya Vikara, and Sidoshaja origin. Next, overview of the Agada Yogas. Agada is referred to as an antidote for poisoning. It is a mixture of antitoxic medication and certain antioxidant, immunomodulator, and or hepatoprotective substances to make up the herbomineral or polyherbal formulation known as Agada. These Agadas possesses anti-inflammatory and antimicrobial properties which are beneficial in alleviating symptoms of Takvikara. Then comes to the mechanism of action of Agada Yogas. First one, detoxification. Agada Yogas work to neutralize and eliminate toxins from the body, thus reducing the toxic load and preventing further accumulation. Then dosha samatva. The drugs in Agada Yogas will help in the maintaining the samavastha of the dosha. Then rasayana. These Agada Yogas, some of the Agada Yogas act as rasayana by addressing root causes of skin disorders and restoring balance. It improves the skin texture and supports overall skin health and vitality. Then case studies are research articles and examples. These are some research articles published in Vata Pradhana Takvikara. We can use for Abhyantara purpose Dushi Vishari Agada, Sanjivina Agada, Bilvadi Agada, Gulu Tiktaka Gruta. And in Pitta Pradhana, Patola Katurohini Adi Kashaya, Guluchadi Kashaya, Dushi Vishari Gulika, and Chandanasava. In Kapha Pradhana, Panchamrita, Panchanimba Gulika, Dushi Vishari Agada, Bhalata Kavati, and Manjistadi Kashaya. Then comes to the challenges and limitations to use these Agada Yogas. First one, variability in patient response. Means differences in how individuals metabolize, means prakriti, and respond to herbal ingredients. Next, quality control and standardization. There is variation in the quality and potency of herbal ingredients used in the Agada Yogas. And also differences in preparation techniques can affect the efficacy and safety of the formulations. Then there will lack of standardized procedures for formulation and dosing may lead to inconsistent results, limited scientific evidence, limited large-scale, high-quality clinical trials evaluating the effectiveness of Agada Yogas, potential side effects and interactions, potential for allergic reactions or side effects from certain ingredients, accessibility and practicability. Herbal sourcing means difficulty in sourcing high quality and authentic herbal ingredients. Then coming to the conclusion, as Kushta Takvikaras are due to Raktavaha Srotodishti Janya and Dravyas In Agada Yogas have it, the Rakta Shodhana, Krumigna, and Oja Vardaka Karma. So these Agada Yogas can be used to treat the Tvakvikara. These are the references. Thank you all.
Thank you, Dr. Maheshwari. Over to you, judges, for the further questions.
Dr. Maheshwari, you had to try an elaboration for the concept of Visha in Tvakvikaras. With just one reference, only Katina Tvakvikaras you will treat with Agada Yogas? Or initially also you can start? Hello? 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 Am I audible?
Yes, you are audible, ma'am.
Where is Dr. Maheshwari?
Sorry, ma'am, she left the presentation. Maybe because of some technical error. We'll proceed to the next presentation.
Fine.
Hello. Hello.
Yes, sir.
Has she left?
Yes, sir.
There were some questions for me also.
She has left the presentation, maybe because of some technical issues, sir.
Okay. Okay, fine.
Now, we'd like to proceed to the next presentation by Dr. Sinchana Yu. That is the third presentee. She is the Assistant Professor of Roganidana Evam Vikriti Vignana from Sri Raghavendra Ayurveda Medical College and Hospital, Malladi. Title of this presentation is Uncovering the Pathology of Premature Hair Graying, an Ayurvedic Insight. Over to you.
Good morning, ma'am. Am I audible, ma'am?
Yes, you're audible.
Hello.
But
Ma'am, is my screen is visible, ma'am?
no, ma'am.
No? Okay, okay. Give me a second, ma'am. I will definitely. Ma'am, is my PPT is visible, ma'am, now?
Yes, it's visible.
Okay, thank you, ma'am. Okay, my topic is myself, Dr. Sinchana. Today, I'm going to give an Ayurvedic insight to uncovering the pathology of premature graying of hair. So, aging is graying of hair is a natural thing in a old age, but nowadays we are seeing it in a like early ages, that is 20 to 30 years, so it is called as premature graying of hair, and it is in Ayurveda it is known as akala palitya, where it is mainly occur due to pitta dosha imbalance, that is especially a brajaka pitta and ranjaka pitta, where the dehoshma and ushma guna of pitta, which circulates the romakopa and causes the paka of hair, leads to graying of hair. Let's see how it happens. Before going to pathology, I want to explain the anatomy and physiology of the graying hair. Here in the image you can see here melanocytes are present in the matrix or matrix of the hair follicle, that is where hair papilla is where blood supply and nerve supply to the hair takes place, and the matrix where the continuous mitosis of the pitta dosha mitosis takes place, that can be considered as a pitta dosha. And we also know that the kesha is the upadhatu of majja dhatu according to Sharangadhara, and mala of asti dhatu according to Charaka and other acharyas. So here we can see as a upadhatu and mala. And when it comes to a physiology and pathological aspect, see, this is the cycle of the hair follicle or hair growth. See, in the anagen phase only we are seeing the more melanocytes, and which is due to like normal agni of the deha. See here, rakta dhatu mala is pitta and also ranjaka pitta according to Sharangadhara. So any deformity or any changes in the rakta dhatu or in the mala of the rakta dhatu, it can directly hamper the varna of the hair follicle. And varna of a tvak is also maintained by the brajaka pitta, which can be correlated to pH, and the cystine level of the melanosome influences the phenotype of the hair. So it can be considered as brajaka pitta. And in ranjaka pitta, pigment melanin is definitely produced by the melanocyte, and which can be correlated to ranjaka pitta. And even the dhatvagni dushti also leads to hair follicle change, like coloring in the hair follicle. So it is the hormone influence, that is the PTH, calcitonin D3 and thyroid hormone. So we will see the individual causes and how it happens in the body. First one is the role of reactive oxygen species, that is the oxidative stress. So due to absent expression of the antioxidants such as the catalase and the melatonin sulfoxide reductase, if this enzyme is not there, then accumulation of the oxidative stress will be there in the hair follicle. That increases the hydrogen peroxide in the that site. So it damages the melanocyte and leads to graying of a hair. This can be correlated to, see, this antioxidant catalase is like absent. That can be considered as the rasa and rakta dhatvagni mandyata. That will lead to Malarupa Pitta Dosha Prakopa. So Pitta Dosha is the Malarupa of the Rakta Dhatu, that is increased in that place, and due to increase in the Pitta Dosha, Ushna and Tikshna Guna also increases, and due to decrease in the Sneha Guna, it leads to the like destruction of the melanocyte, and it does not produce the melanin, so it leads to graying of hair. See, in this picture you can see that. And a genetic factor, mutation, you see, it is not only a mutation like genetic mutation. In the epigenetics, here we can see the change in the mRNA and tRNA, that is without changing the code, the protein, like final product, that is the protein changes will be there in the body. That can be considered as pitta dosha and vata dosha. So that the genetic level changes due to environmental and other factors, it leads to a graying of hair. And another factor is the one gene is responsible for the graying of hair, that is most probably present in the gray hair people. That can be considered as a pitta prakriti person. We know that the pitta prakriti person is having the gray hair. And another thing is that due to impaired metabolism, that is the hormonal imbalance. We know that the thyroid, like even in the hyperthyroidism and in the hypothyroidism, we can see the like it can cause the body to produce the less melanin. These are all the research done by the recent medical science, and according by correlating that, the even the medodhatu and asti dhatvagni mandata can lead to a or the metabolism that leads to graying of hair. And even the kesha is the mala of asti dhatu. This can be considered here. And even the stress hormones like excuse me. Even the stress hormones like a noradrenaline will leads to increases the pitta dosha and vata dosha. That can be increases the dehoshma and in leads to even the graying of hair. And in the deficiency, see, severe iron deficiency and copper deficiency, see, these enzymes or these ions are help bind to this enzyme, that is the tyrosinase, that is essential enzyme activity and thus process the melanogenesis. See here, if it deficiency is there, that is the even ranjaka pitta, that is the heme part of the hemoglobin, and even the kesha is the upadhatu of majjadota, that is the stem cells. If it is reduced, then it leads to a hair follicle or like graying of hair. In the pernicious anemia, that is the bhutagni and pitadara kala dushti will be there. In the chronic protein losses, like in the koshaka, these things, we can see that samanya rudikaram, if nourishment is not proper, then the upadhatu or like dhatu poshana will be less, and even the mala will also change, and even due to upadhatu effect also, kesha will change its color.
Thank you, Dr. Sinchana. Your time is up. Over to you, judges, for the further questions.
Hello. Dr. Sinchana, am I audible? Hello.
Hello, yes sir, you are audible sir. Yes sir.
Can you throw some light on, you said no, Ranjaka Pitta?
Yes sir, yes sir, yes sir.
Clearly the reference goes for Rasaranjana only. That means it can be considered as the factor which gives red color to the blood. Okay,
Sir.
so can you throw some light that all the colorings or all the pigmentations in the body, you said hair, na? So
Yes sir, yes sir.
how can you throw the light on Ranjaka Pitta? Because Ranjaka is only for Rasaranjana. And why not Brajaka? Because if it is Brajaka is for skin,
Yes sir, yes
so
sir.
the word Brajana means not just glow, it means the overall conditioning and the healthy status of the skin with normal functions of all the skin tissues
Yes sir, yes
related to
sir.
everything.
Yes sir.
So why not it is Brajaka and why it is Ranjaka? And if you substantiate and if you defend your point, then it will be very wonderful.
Yeah, thank you, sir. Sir, definitely it is not only Ranjaka Pitta, sir. Definitely it also like involve the Brajaka Pitta also, because that mitosis action that takes place is due to Brajaka Pitta, sir. So, and if for example in Ranjaka Pitta, for a hemogenesis, like for a cell like HB or like in a iron, if for example I will take the example of iron, sir. Iron is a part of hemoglobin, that is the Ranjaka, that is like which gives the color to blood, right, sir? Like hemoglobin that contains the iron. If that is also deficient, it also leads to the graying of hair, because we many in modern science, sir, there are like recently they studied like premature of graying or hair is very common in the pernicious anemic disease, sir, where the vitamin B12 deficiency is also there. Even in the iron deficiency also, they can see the gray hair. So even the Ranjaka Pitta is also having the impact on a melanocyte like production, sir. So I believe that it's like my hypothesis that even Ranjaka Pitta is also involved in the graying of hair or like pigmentation. And when comes to Brajaka Pitta, sir, it is like due to Ushmagni. If increases its pH level in the hair follicle, it leads to the destruction of melanocytes, sir. So Brajaka Pitta, if it is increased, then it definitely lead to destruction of melanocytes. So by this, I consider it as both Brajaka and Ranjaka Pitta is involved in the graying of hair, sir. Thank you, sir. Hello, sir. Am I audible, sir?
I heard your answer, and somewhere there is some dissatisfaction because we cannot directly agree with the points what you discussed. Because
Yes.
if it is the health of the hair, Asti
Yes,
Dhatu also plays a very important role.
Yes, sir, definitely, sir. Even I mentioned that also, sir, because even vitamin D3 deficiency or in the thyroid hormone changes, that even in the calcitonin, these also, like, these things are according to modern research, sir. What I am telling is,
Okay,
like,
thyroid in the sense, will you say hypo or hyper?
Sir, definitely in the both, but usually in the hyperthyroidism, we can see the nice hair growth and all hair nourishment will be there. But in the hypo, there will be always like brittle hair and these things will be there. But according to like modern research papers, sir, what I have gone through, they studied some of the group of people and they conclude the thing that even both hypo and hyperthyroidism leads to graying of hair, sir.
Okay. Okay, fine.
Okay, sir. Okay, thank you so much, sir.
Sinchana, can you highlight on the treatment modalities, the variations as per the cause?
Yes, ma'am, definitely. See, when we see the gray hair in the younger adult, we have to see for the first cause, like why it's happening. Based on that, we can treat, ma'am. For example, if thyroid is the issue, like if hypo, then definitely if we treat with the thyroid disorder, then definitely we can reduce the graying of or premature graying of hair. If it comes to deficiency, for example, iron deficiency or a copper deficiency, these two are very important in the melanocyte generation. So
no, okay, Dr. Sinchana, okay.
Yes, ma'am.
That is not my question. My question is, treating the particular cause is over. How will you, as per the cause, what will you target to the graying of hair? What medication, differences in medication, apart from the cause? Now, thyroid, you will treat thyroid, okay. But specifically, will you give any treatment for graying or only manage with the treatment of thyroid disorders or anemia?
No, ma'am. Definitely, I go for a both internal and external application, ma'am. Externally, directly by application, for example, Pitta Shamaka Dravyas we can use for a scalp, ma'am, so that Pitta or Brajaka Pitta will reduce in its own place, and even the
Examples. I want practical answers, Sinchana, not theoretical. You have explained all regarding theory.
Yes,
Examples, variation in the drugs available clinically. What will you give to your patients?
Okay, ma'am. Ma'am, even the Bringaraja Churna internally, by giving that internally, it act on a ekrit, ma'am, so that the pigmentation in the skin as well as in the hair can be we can get it back, ma'am. I have seen the cases in the vitiligo and as well as in the gray hair, ma'am.
Is it common for all disorders? That is my question. You have said various causes. I want specific hair treatments in various causes. How will this vary?
Ma'am, definitely I'll try in the next thing, ma'am.
Okay, fine.
Okay. Thank you, ma'am. Thank you so much, ma'am.
Thank you, Dr. Sinchana, and thank you, judges. Now, moving on to the next presentation by Dr. Bharat Dubey, Assistant Professor, Ayurveda Samhita and Siddhanta from Rajiv Institute of Ayurvedic Medical Science and Research Center, Hassan. Title of presentation is Exploring the Role of Niruha Basti in Enhancing Skin Color, a Scientific Evaluation of Ayurvedic Principles and Practices. Over to you, Dr. Bharat.
Ma'am, am I audible?
Yes, sir, you're audible.
Yes.
Your screen is at to share.
Yes. 1 minute. Is it visible, ma'am? Is my presentation visible?
Yes, sir, it's visible. You can start, sir.
Okay. Shri Guru Bhyo Namaha. Myself, Dr. Bharat, Assistant Professor, Samhita Siddhanta Department. Title of my topic is Exploring the Role of Niruha Basti in Enhancing Skin Color, Varna, a Scientific Evaluation of Ayurvedic Principles and Practices. Introduction. In Ayurveda, the concept of Varna skin complexion extends beyond mere aesthetics. It is also a parameter to assess the status of Tridosha in human body, as Vivarnata of Tvacha indicates imbalance of Tridosha. Tvak Prasadana or Varnalabha are said as benefits of most of the Rasayana Chikitsa, which is an after effect of complete nourishment of all dhatus. The primary causes of abnormal skin coloration are typically linked to vitiated Vata dosha and Pitta dosha. Specifically, Vata dosha may lead to darker skin tones, while Vikrita Pitta dosha can result in a loss of luster and contribute to various skin disorders. Other important factors which tells about Varna are Ahara Rasa, Agni, Prakriti Vikriti of Shonita, Sharirika Prakriti, Ojas, Desha, and genetics of human race. Shastra Sandarbha, that is references. In Bahudosha Lakshana, we can see that even though the person is very well nourished and Bala Varna Pranasha can be seen. In the same chapter, benefits of Samshodhana tells that Indriyani Mano Buddhi Varnascha Asya Prasidati. And Raktam, Varna Prasadam, Mamsa Pushtin Jivayati cha, it is said in the Prakrita Karma of Rakta in Sushruta Samhita. Abnormalities of skin are mentioned under Rakta Pradosha, Rasa Pradoshaja, Rakta Pradoshaja, Mamsa Pradoshaja, and Asti Pradoshaja Vikaras of Charaka Samhita Sutrasthana. Normal and abnormal skin colors are Krishna, Shyama, Shyamavadata, Avadata are said as the Prakriti Varna of Sharira, whereas Neela, Shyava, Shavata, Tamra, Harita, and Shukla are said as the Vikruti of Varna, and status of Varna is also an indicator of Arishta Lakshana. Role of Vata dosha and Pitta dosha in skin coloring. In Vata Kalakali Adhyaya, if the Sharira Chara Vata gets aggravated, that is Kupitastu Khalu Sharire, Shariram, Nana Videhi Vikarehi Upatapati, Bala Varna Sukha Ayusham Upaghataya. So Kupita Vata dosha definitely going to hamper the Varna of a person. And Prakriti Vikriti Varna are said in the context of karmas of Pitta dosha. Prakrita Varna and Vikrita Varna both will be invariably associated with Pitta dosha. Tvakstam Bhrajakam Bhrajanat Tvachaha. Bhrajaka Pitta helps in the brilliance of skin. And role of Niruha Basti. In this reference, we can see the benefits of Niruha Basti is Swara Varna Krit Cha. And in the last, they are telling about Vishwakstitam Dosha Chayam Nirasya Sarvan Vikaran Shamaye Niruha. By default, Niruha Basti cleanses all the doshas present throughout the body and benefits the person with good complexion. Shastra Mantana, its critical analysis. Vaivarnya of Tvacha is the Pradhana Lakshana in all types of Kushta, but Niruha Basti is not included in Chikitsa Sutra of Kushta. We can see Chikitsa Sutra here. This situation may arise because in Kushta, doshas cannot be expelled from the body all at once. Stoka Dosha Nirharana by giving Mrudu Shodhana Chikitsa multiple times would be an ideal treatment here. Another perspective suggests that since Kushta is considered as a Santarpana Janya Vyadhi, an Apatarpana approach may be more appropriate. Whereas Niruha Basti is also a method of Santarpana along with Shodhana Chikitsa. But Acharya Charaka also gives the leniency to Vaidya. If the disease condition demands Niruha Basti with proper combination, one can administer Basti Chikitsa even in Kushta disease also. Avastham Prapya Nirdishtam Kushtinam Basti Karmacha. Thus, Niruha Basti being a Shodhana therapy and Rasayana therapy is a potent tool to eliminate Vikrita doshas out of the body and enhance the Varna of a person. This can also used in other skin diseases as a method of Pradhana Chikitsa, and this is a Drishta Karma, that is a clinical application or evidence-based study. The effect of Katukyali Basti in acne vulgaris Mukhadushika, a case study has been presented, and it is the citation and references are given in the presentation screen. Chikitsa Prayoga, scope in treatment. After careful assessment of Niruha Basti, Arha and Anarha Purusha, a Niruha Basti could be formulated which would be said as a Varnya Basti or Varna Prasadana Basti. The main ingredient of this Niruha Basti, say for example Kashaya, can be made from the Varnya Dravyas from Charakokta Dashemani Gana, like the drugs are given in the screen, and a demo clinical presentations which are subjected to necessary changes by the Yukti of Vaidya can be same. Say like Makshika, Lavana, Taila, Kalka and Kwatha. The Kwatha would be prepared from the Varnya Gana Dravya from Charakokta Dashemani Gana can be used as a Varnya Basti. For Anuvasana, Varnya Taila, Manjishtali Dravyas which would do Varna Prasadana can be used. Nirnaya, the conclusion, Ayurveda always focus on treating a disease from its root cause. Enhancement of skin complexion requires consideration of multiple factors as it's mentioned in this presentation. Simply by applying the external treatments is insufficient without addressing the underlying imbalances. Niruha Basti is a potent mode of eliminating Vikruta doshas, and by default it benefits with all the effects of Rasayana, especially with Varna Prasadana. The inclusion of Varnya Dashemani Gana in Niruha Basti formulation targets both the root cause of the skin issues and provides a focused clinical approach to treatment. Thank you.
Thank you, Dr. Bharat. Over to you, judges.
Dr. Bharat,
Yes, ma'am.
the use of basti, should it be, you have specifically mentioned it for the kusta, isn't it? So when it should be administered? What is your idea?
It is like, ma'am, it should be administered when there is more Bahudosha Avastha and Vikrita Dosha Lakshanas are there. At that time, for the removal of doshas from the body, and as a target oriented, our specific target is to increase the Varna of a person. In that condition, this treatment would be ideal, ma'am.
Could you name some disorders where such things can be? Could you give some examples with some disorders?
Yes, ma'am. In present days, it is trending that as a part of cosmetics in a combination of Ayurveda, bridal makeup or something like that, Shodhana complete package where a person who want to enhance their natural beauty are given Shodhana initially, later that go on with the
Dr. Bharat, you are confused. You are confused. My question is, that is why I asked the first questions. You said me it is in the Bahudosha Avastha in a Vyadhi called as Kushta. In a bridal makeup or somebody who is interested to enhance the beauty, how will you correlate with Bahudosha Avastha or where there is Kushta there?
No, ma'am. This is Varnya Basti would be indicated to enhance the color of that person, ma'am. Varnya Basti.
So then your Bahudosha Avastha, the basic concept of Varnya Basti. See, there are two things in your presentations and you really seem to be confused. You have mentioned that Santarpanajanya Vyadhi, still you can go for as a treatment modality, Niruha Basti has been administered, and you're telling us the reference of Varnya Basti also. So Varnya Basti is something different apart from Kushta, treatment of Kushta, is it?
Yes.
Or
yes,
you're indicating Varnya Basti for Kushta also?
No, ma'am. Let me clarify this, ma'am. First of all, I told that Basti in Kushta, it is given that there may be a chance that, see, in this slide we can see that in Chikitsa Sutra of Kushta there is no indication of Basti. So some people may think that in Kushta this Niruha Basti cannot be used.
Yes, in that, one minute, Dr. Bharat. Yes, then you have suggested that even though there is no proper reference, with some particular cause, you are propagating the use of this basti, isn't it?
Yes, ma'am.
That is your basic ideology.
Yes, ma'am. In next slide, they have given Avastam Prapya Nirdishtam Kushtinam Basti Karmacha. This is given by Acharya Charaka.
An example for this now? Yes, I got your point. Give me a practical example with the disease for this.
Yes, ma'am. This is the clinical example of presentation. The effect of Katukyadi Basti in acne vulgaris is a case study has been presented, ma'am. In Mukadushika.
When in acne, I got this. Yes, I got this. Which avastha of Mukadushika will you go for this Basti? That is my question.
In which avastha, in a severe case of Mukadushika where all the modalities failed, means after repeated Raktamokshana, after repeated external therapy also the Mukadushika still not treated. In such conditions, a Basti can be given, ma'am.
Okay. After the fail of all the treatment, then you want to try with Basti, is it?
Yes, ma'am.
Okay. And then?
And then this is a Chikitsa Prayoga. It is a formulation proposed. This can be used. As Varnya Dashemani Gana is said in Charaka Samhita, a person who is targeted to enhance his skin color, that is Varnya only, for them this demo clinical prescription has been given.
Okay. And any diseases where you can use this Varnya Basti? Would you suggest? Apart from people who are interested to enhance their Varnya?
As the Dashamani Gana itself is target-oriented Varnya, means through which enhances the skin color. The primary goal would be focusing on increasing the skin color itself.
So in pigmentary disorders, can't you use this?
Yes, ma'am. It can be used.
Okay.
But yes, ma'am. Let me tell one thing. In pigmentary disorders, it will be like local oriented, ma'am. In case of hyperpigmentation of the skin, usually they go with the LAPAs only over that part. Whereas this Varnya Basti will.
What about disorders with hypopigmentation? Don't you have disorders involving hypopigmentation all around the body?
Yes, ma'am. In that condition also it can be used. That Varnya Basti which brings into normalcy in the Ayurveda treatments, which does into Dhatu Samyata, excess Vruddhi or Kshaya of everything will be bring into normalcy. If it is present,
why Basti then there? Why Basti then there? Basti is a chikitsa for Vata Vyadhis. And if it is Varnya that is involved, then what treatment is important?
Yes, ma'am. This is the role of Niruha Basti in enhancing skin. It is not only skin color, it is the benefits of Basti. Basti Vayastapayita Sukayur Bala Medagni Swara Varna Krutcha, it is said in the benefits of Basti itself. And in the last line, they have said Vishvakstitam Dosha Chayam Nirasya Sarvan Vikaran Shamayen Niruha. Means Vishvakstita means completely the doshas present completely all over the body, that will be eliminated Basti, and it is helpful to treat all the Vikaras. Shamayen Niruha. For that, if a person is want to increase the skin color all over the body, then Basti would be ideal treatment.
Then can't we go for Anuvasana Basti? Why should we go for your Niruha Basti? Isn't a Matra Basti better with Varnagana?
Yes, ma'am.
In hypopigmentary disorder. Also or must is my question. ये उल्टा चल रहा है, Dr. Bharat. I am giving the answers and giving leading questions to you to answer me. You have to, when you suggest such bastis, you have to think of all possibilities, isn't it? And nobody would go for prasadana only. We have to target more on curative aspects of basti. Just for beauty, cosmetology, people would not be happy with basti chikitsa. They would rather prefer other modes of treatment. I think so. Practically, what you're, this is a proposal, isn't it? This is your hypothesis.
Yeah.
Do you have any clinical experience by this?
No, ma'am. It is the first time I am giving proposal. This can be used in cosmetology also.
So when you give a hypothesis, I get it. When you give a hypothesis, you should always think of all the pros and cons, isn't it? So maybe this hypothesis is not very well acceptable. Matra Basti is still okay. Niruha Basti for Varna Prasadana. Do you think people will agree? Only people with so much of, and we don't know the mode of action, and it does not go also along with the dosha. Also, it doesn't go so well. So maybe you have to rethink on your hypothesis. Okay, fine, Dr.
Okay, ma'am. Thank you.
Hello.
Yes, sir.
Yeah, thanks to madam also. I'm enjoying your conversation because as madam said, she is giving leading questions to you and confused. Let me confuse you a bit also. There are three words. That is Krishnikarna, Shvetikarna and Savarnikarna. Have you heard about it?
Yes. Yes,
okay,
sir, yes,
so, and there is one more very important concept in Charak Samhita, Anastapyaha Kushtinaha. That means Basti is totally contraindicated in any Kushta Vikaras. So the mode of action of Nirobasti, what you told, is a generalized factor. It's not related to Kushta. When you give Nirobasti, the entire health of the patient is going to improve, so that the glow and the healthy status of the skin also is going to improve. But specifically, Basti is never indicated in Kushta. Okay. So what is your point on this?
Yes, sir. For this reference I have put for this, sir. Avastam prapya nirdishtam kushtinam basti karmacha. It is said that if the avastha demands, a physician can go for basti karma even in kushta also. This is the classical reference we get, sir. And for that, this is the Shastra Mantana, why that Basti is not included in Kushta, because it is a Santarpana Janya Vyadi, as it is said, and Niruha Basti is also doing Santarpana and along with Shodhana. That is why it may not be included in Chikitsa Sutra of Basti, sir.
No, correct. Avastham prapya is correct. But can you throw some light on that? That what is that avastha that where the condition demands basti in kushta? When all this vamana, virechana, rakta mokshana, nasya, shira virechana, etc.
Yes, sir.
Doesn't going to work, and what are the indications of basti? What do you feel?
Sir,
When
that
should be basti given?
for in case of Kushta, sir.
Yeah,
Only
in
in
case
case
of
of
in
sir.
case of kushta only. What do you have to elaborate on? What is the meaning of avastham prapya? That is the meaning. That's my question.
Yes, sir. Avastham prapya is when there is severe aggravation of vata dosha. That is the avastha prapya, where other treatment modalities are incapable of controlling the vata dosha apart from basti. Then the role of basti came into action, sir.
Then, as Madam said, anuvasana will be good. Why Nirva then?
Yes, sir. Anuvasana would be good, but daily Anuvasana, without doing the Shodhana, Anuvasana is more of a nourishing, sir. Whereas Niruha is both, it is cleansing and nourishing. Before nourish, we have to clean the things and we have to nourish later on, sir. That's why before Anuvasana, Niruha would be ideal treatment.
What if I give Mrudu Shodhana like Mrudu Virechana and then give Anuvasana basti?
That is also possible, sir. That is also possible.
Yeah, when that's also possible, you have to defend yourself that why not Mrudu Virechana, why Niruha basti, then Anuvasana. That you have to defend.
Okay, sir. That is as I concentrate on these benefits of Basti, like it is both Varnakara and it is also elimination of both doshas out of the body, sir. So as multiple benefits we are getting from single action, so I thought this would be an ideal proposal of treatment.
Yeah, okay. You tried your level best, but the point is, there are some specific indications that even in Chakrapani commentary, where there is Niro is Anasthapya Krishna is told, there also he clearly says that that only Avastham Prapya, where it is Niro Eka Sadhya, means only that condition where Niro is the only treatment left, whereas other indications are not there for the patient. Then if the basti is to be indicated where the lesions are in the Adho Sharira, Vatasthana, and also the doshas are in the Pakvashaya specifically, Vata Pradhana Tridoshas are specifically in the Pakvashaya, then you have to think that, okay, Anuvasana Basti may not help. So, one Mrudu Shodhana can be given, or else Niro Basti can be given only for Shodhanartha, not where Virechana fails, only Niro Basti is the choice left for Shodhana. Then Anuvasana can be given. For that, also, only two Bastis, Patoladi, Niro Basti is told in this one, Charak Samhita, and also I think the same Patala Grita or Patala Sneha can be given. That's also Jitadravas only. But fine, you tried your level best for giving the answer. Okay? Thank you.
Okay. Thank you, sir. Thank you. Thank you, ma'am. Thank you, sir.
Thank you, Dr. Bharat. Thank you, judges. Now, moving on to the fifth presentation, that is by Dr. Priyanka H.C., Assistant Professor Ayurveda Samhita and Siddhanta from Ashwini College, Medical College and PG Center, Davanagere. Title of presentation is Conceptual View of Trichology and Cosmetology in Ayurveda. Over to you, Dr. Priyanka.
Ma'am, am I audible?
Yes, ma'am, you are audible.
Wait a minute, ma'am. I'll share the screen.
Ma'am, as Ayurveda as a life science has given equal importance to both preventive as well as the curative aspects. Since early age, human life has a great impact on external appearance of oneself. External beauty has gained a lot of attention and demand in ancient as well as in today's era also. So hair and skin is such an aspect among external appearance which has everyone are more conscious about their appearance. So hair is such a natural ornament which everyone of us would flaunt for. So the word kesha has been derived from the root she with the ich prefix and a kulak conjugation that which grows on the head. So how the hair is growth? So it has been further explained that the poshakamsha of the former dhatu, there is not only the production of later dhatu but consequently there is a side by side production of its upadhatu and its mala. So there is no detailed description found in classics, but the production of hair in particular, but it has been stated that the process of dhatu nirmana, that when paka of asti dhatu occurs by its own agni, the majja dhatu emerges from sarabhaga. At the same time only the hair of the scalp and the body nail emerges. So hair is one of the Pitruja Bhava, means the structure, color and the quality of the hair progeny are dependent on the parental side. So the Lomadi Utpatti Kala, Kesha Utpatti Kala in fetus is considered as 7th month and the 6th month has gestation respectively. So before the development of placental circulation, Garbha portion is achieved through Lomakupas. Coming to the count of hair, Acharya Charaka enumerated totally 29956 stated that number of Kesha, Shramshu, Loma are equal. So, next coming to the Kesha in relation to the Medosara Purushas possess excessive snigdha in their complexion. They have beautiful hair on their head, face and bodies. So, Kesha in relation to the Prakriti showing skin and quality of the hair according to the different Prakritis. Coming to the Vatala Prakriti, Dursara, the quality of the hair will be Ati Ruksha, Sputita and Alpa. And coming to the Pitta Prakriti Purushas, the Pingala, Valipalita and Kalitya, quality of hairs. And coming to the Shleshmala, Krishna and Atinila color, hair quality will be Snigdha, Bahu, Gana, Stira and Kutila. So, importance of hair in diagnosis purpose. So, as a Arishta Lakshana, we can see that mated eyelashes or brew are indicative for in Sadhyomana, that is in immediate death. If pulling of Kesha, Loma and uprooting Kesha does not cause any pain in that person, it is an indicative of immediate death. And when the hair appears greasy or when no snigdha substance is applied to it, this is also an indicator of infant death. So, has a prognostic sign, Loma Harsha, symptom in Pushta, Akuvisha, Uchitanga Visha or Dushi Visha. And coming to the elimination of the treatment, so Atiloma and Aloma are described as a Nindita to whom there is contraindications. And coming to the anticipation of twins pregnancy, the presence of Roma Raji in downward direction indicates the twin pregnancy. Then coming to the clinical assessment in Vamana, the Loma Harshas, it indicates the movement of dosha from Shaka to the Koshta after giving Vamana Aushadas. For treatment purpose, in Bhela Samhita it is mentioned to give churnas of Kesha, Madhu, Takramanda to be given in order to initiate Vamana. When Vamana does not occur within a Muhurta Kala, after given Vamana Aushada, Acharya Shushruta has enlisted Kesha as one among the Upayantras. Coming to the premonitory symptoms, excessive growth of Kesha, Loma are included among premonitory signs and symptoms of Prameha and Shoshavyadi. So, coming to the measures for maintaining our hairs, the first stands for Nasya, next comes the Murdhathaila, Snana, Dhumapana, Kshaurakarma, Ushnika, Karma. Coming to the Patya and Apatya for hair, the Patya, Shiro Abhyanga, Goduma, Yava, Shali, Mudga, Jivanti, everything as explained. Then coming to the Apatya, the first one, excessive Ati Sevana of the Lavana, Amla, Katurasa and Kshara Sevanas. Then Coming to the cosmetology, that is Varnya, the Ayurveda cosmetology stands for the started from the mother's womb, which is determined at the time of Shukra Shonita Samyoga. Kanti, Chaya, Varna, Prabha are beautifully explained and depends on Matruja, Pitruja, Rasaja, and Satmaja Bhavas with the predominance of Mahabhutas. Ayurvedic cosmeticals are always ahead for their safe and holistic actions. According to the Ayurveda, concept of cosmetology is not only merely limited up to the beautiful skin and hair, it also includes physical, mental, and social elements also. So, healthy skin is a result of overall health condition and of individuals, which includes Prakruta dosha, Shrotas, Agni, and the Dhatus. So, the Ayurveda believes cosmetology from Garbhavastha only. In Garbha Samskara, 5th and 6th months are considered for effective for the treatment of Varna of the Chikitsas. So Dhatu involved in the beautiful skin and hairs are Rasa Rakta. Rasa Dhatu nourishes Rakta Dhatu, where functions of Rakta is Varna Prasadana. Tvak Saukumarata is the karma of Swedas. Next, so Twacha is one among the Indriya Adhisthana which completely covers Meda, Shonita and all the dhatus of the Sharira, and it extensive all over the body. It is considered as the site of Spashanendriya as well as one of the main site of Vata and Pitta doshas.
Thank you, Dr. Priyanka. Over to you, judges, for the further questions.
Dr. Priyanka. Hello. Is Dr. Priyanka here? Am I audible? Hello. Hello.
Hello.
She too doesn't seem to be
Dr.
online, ma'am.
Priyanka.
Maybe she has quit. I don't know.
Yes. Dr. Priyanka.
It seems like Dr. Priyanka has left the meeting, ma'am.
So organizers, should we consider these people for this one? Because Q&A, I think 2 people did involve. Hello?
There's no answer from organizers as well, sir.
Yeah, madam.
Hello.
I was asking
Sorry,
the
sir.
clarification. Should we include these people who have not given involved in QA for this one presentation, or should we?
Yeah.
What is the rules? I don't know.
Actually, yes, sir. Maybe they have left because of some technical issues. We'll see through it, sir.
Okay.
Thank you, sir. Can we move on to the further, sir?
Yes, ma'am, please.
Okay, thank you, ma'am. So the next presentation, that is sixth presentation by Dr. Navanita Sengupata. She's an assistant professor.
Yeah, ma'am. Am I audible?
Assistant Professor of Kaya Chikitsa from Sri JGS Ayurvedic Medical College and Hospital, Ghataprabha, Belgavi. Title of presentation is Role of Asti Majja Sroto Dushti Chikitsa in Kalitya Vyadhi to Male Pattern of Baldness. A review article. Over to you, ma'am.
Yeah, ma'am. Am I audible?
Yes, you're audible.
Okay, ma'am. Just let me share the screen, please. Yeah, ma'am. Is the screen is visible?
Yes, ma'am. Yes, ma'am. You can proceed.
Okay. Okay. Thank you, ma'am. So my topic of presentation is role of Asti Maja Srotodushti Chikitsa in Khalitya Vyadhi with special reference to male pattern of baldness. So coming to the next slide. So the first I will question the Samhita. So Khalitya has been described in almost all the Ayurvedic literatures, but sorry, basically it has been described by Acharya Charaka and Ashtang Hrudayakara in Shirorogas, whereas in Sushruta, Ashtang Sangraya, Yog Ratnakar and Madhav Nidan, it has been described under the Shudra Rogas. So Khalitya is now a main concern in the modern era. So it has been classified into Ayurvedic text as Khalitya Vyadhi. So majority of the population, like 1.7%, has been suffering from the Khalitya due to lifestyle, stress disorders, hormonal fluctuations, sedentary ways of life, and indiscriminate dietary habits. So it has been seen that 60% of men are suffering from the Khalitya than that of women who are only 25%. So the question is why me? So there are various factors for the formation of the Khalitya Vyadhi. The one is the Ushna Guna of the Pitta dosha, that is Pitta Prakriti persons are mainly having prone of Khalitya. The second is the early hair fall, that is at the age group of 30 to 40 years. Then the other Shiro Rogas, which are one of the causative factor. Excessive consumption of the Katu Amla and Lavana Rasa, which are Pitta vitiated, and the mood swings like Ati Krodha, Ati Vyama, Ati Jalpa, Ati Hasana. So basically, it has been seen that hair fall can be caused because of the vitiation of the Asti Dhatu and Majja Dhatu, as it involves the vitiation of the Vata and Pitta doshas along with the Kapha dosha. Approach to a Khalitya patient. Disturbance at the level of the Srotas can be leading to the Khalitya Vyadhi. So the disturbance or the Dushti into the Srotas occurs at the root of the Rasa Dhatu or the Rasa Vasrotas, then it will move on to the Rakta Mounsa, then Asti and Majja and Sweda Vasrotas. So basically it is a three dosha Janna Vyadhi, that is the Vata, Pitta, Kapha are involved and along with the Rakta dosha. So vitiated Pitta, that is basically the Bhrajak Pitta is involved along with the Samanavayu and the Vyanavayu, which lead to the weakening of the hair roots, and thus there is an hair fall. And along with that, into the later stage, the vitiated kapha along with the Rakta Dhatu will obstruct the hair roots to further prevent the formation of the new hair. So there is a schematic presentation of the Samprapti in the Khalitya Vyadhi. So the dosh is mainly the Pachak Pitta and the Bhrajak Pitta, because it is occurring because of the Agni Manda, and basically there will be the Rasa Srota Dushti, and Uttar Dhatu formation will be hampered. And as we all know that the Asti Dhatu Mala Kesha, whereas according to the Sharindara, it is the Upadhatu of the Majja Dhatu. So the Dusha involved are the Rasa Rakta and the Asti. Mala are the Swed and Kesha according to the Asti Dhatu, and the Srotas involved are the Rasa Rakta, Asti, Sweda and Manova Srotas Dushti. Basically, it's a Roga Marg which is related to the Bahya Marga, and Udbhav Sthan is the Amashaya. So the Ayurveda intervention or the Chikitsa to adopt for the Khalitya is the Nidana Parivarjanam. And the next one is the Samshamanam. So Samshamanam is the local application, that is the Abhyanga. So Abhyanga in the form of various telas, that is the medicated telas, we can use it. So it is Ushna, Shukshma and Vikasi and Srotogami. So it will land up into the Shaman of the Vata, basically the Vyanavata and the Samanavata. Then the Shirolepas, which are Shita Gunatmak, they can be given to the patient in the form of lepas to reduce or the mitigate the Bhrajak Pitta. And the Rasayan and Kesha Aushadhis has been mentioned for the Dhatu Poshana, for the Uttara Dhatu. Now coming to the role of Asti Maja Srota Dushti in the Khalitya. So it has been stated in the Charaka Sutra Sthan 28th Adhyay, 18th sutra, that Astiva Srotas Dushti is the genesis of the Khalitya Vyadhi, as it lead to the formation of the Kitta Bhaga, that is the Kesh and Naka, is being vitiated. And it has been also stated that though there is a Rakta Dhatu vitiation, so Rakta and Pitta are having ashray relationship. So therefore, Majjadhara Kala and the Pittadhara Kala is being equally involved into this. So the Basti Chikitsa with Tikta, Sarpi and Shira has been stated into Acharya Charak in Astiva Sruta Dushti Vikaras. And into the Majjadhatu Chikitsa, Madhura Tikta Anna Sevana has been described by the Acharya Charak in Charaka Sutrastan 28 Adhyay and 20th Sutra. So these are some of the formulations which are used. So the medicated oils like Nilini Tela, Mahanila Tela, Snu, then Chandanadya Tela. Some of the Nasa is also basically important because it is treating the Majjadhara Kala. So Anu Tela Nasa, then Nimba Tela Nasya, Bhrungaraja Rasa, that is Nasya mixed with milk can be given. Lepas like Madhuka Amlaka honey, Tila Amlaka honey oil can be given for the lepas. And the basic important part is the Rasayana Chikitsa, that is giving Uttara Dhatu Pushti. So Agastya Haritaki, then Kanaka Rishta, Dvipanchamula Gruta, Amlaki Rasayan, and Bandura Bhasma can also be a good adoptive measures. So inference to be drawn is the Astidhara Kala and Purishadhara Kala having Ashray Bhava. So Basti plays an important role in the treatment of Khalitya. And in Khalitya, Pitta Tushti also plays an important role, mainly the Bhrajak Pitta and the Rakta Dhatu. Therefore, protocol of Chikitsa focus on the Majja Sruta Dushti Chikitsa. And the Virechan and Rakta Mokshan can play a significant role to relieve the Khalitya, and it may also treat the Majja Dhatu as well. And basically, the treatment line of Shodhan contributes to treat the Asti and the Majja Sroto Dushti, thus treating the Khalitya Vyadhi. Thank you.
Dr. Navanita, judges, over to you.
Yeah.
Dr. Navnita,
Yes,
audible
sir.
to you? Yeah.
Yes, sir.
You're in which department?
Sir, I am in Department of Kai Chikitsa.
Okay. How many years of experience of teaching?
Sir, basically I have 5 years now, sir, completed.
Okay.
6th year is running.
I'm asking this question because Khalitya as Asti Vaha Shota Vikara Basti completely cannot be digested because
Okay, sir.
Khalitya may occur without Asti Vaha Shota also.
Okay,
We
sir.
have
Yes.
seen many people where Khalitya and Phalitya is Rasa Pradasha Vikara also.
Yes,
Akala
sir.
Valaya Phalitanicha is there and Khalitya is not there. But Khalitya, for example, if you consider this androgens, it is a pattern,
Yes.
male pattern or female pattern,
Yes.
then even any treatment is not going to work because it's a Bija dosha. And
Yes, sir.
obviously,
It's a
Bhakti
Bija
will never
dosha
work also. Yeah,
Vikara.
and Bhakti will also never
Yes.
work. So somewhat there is a confusion in your mind about the Khalitya as a disease of Shuddha and Khalitya related to Astikshaya because I am asking this authentically because my PhD and PG both are in osteoporosis. So I
Okay,
have
sir.
worked on this. That's why I'm asking this question.
Sir, actually in my presentation, I have focused on to the Astiva Srotas and Majava Srotas. Basically, in the treatment of the Khalitya, we have to consider Rasa, Rakta, then Maunsa, then Asti, Majja, Shukra, all the dhatus are involved. But in my presentation, I'm means focusing on to that part. If there is an Asti Dushti or the means Majja Dushti is there, then we can treat it and we can define a protocol in Ayurveda to form a treatment line onto that.
I don't agree with Majja. Totally, I don't agree with Majja because I don't know what the other expert madam will definitely speak on this. But Majja has no role with Khalitya.
Okay, sir, but I have tried to correlate it with the Majja Sroto Dushti, sir. That is basically my presentation uniqueness. So I wanted to correlate it in my concept.
Yeah. As teachers, we can correlate. But as the 6 qualities of Vaidya, Vidya, Vitarka, Vijnana, I mean that Vitarka means Shastra Mula Uha Poha. That means whatever you correlate, you have to give a Shastric evidence to defend your point. So
Yes,
never
sir,
ever in
basically
Majja.
Majjadhara. Sir, Majadhara Kala and Pittadhara Kala are related to that each other. So that's why that means that the Murdha is the basic Adhishtan for the Khalitya Vyadhi. So if we are taking into account the Visheshan of the Pitta, that to a Prajak Pitta and Pachak Pitta, so we can like correlate in that sense that Majadhara Kala is also involved and Majavasrutas is means involved
No, why
into
did you take
Khalitya
Pitta
Vyadhi.
here? Why did you take Pitta here?
Sir,
What is the role of Pitta in Khalitya?
Sir, Pitta like Agni Mand is there, sir. So basically there is a Pachak Pitta Dushti is there. Agni Mand is there, sir. And Bhrajak Pitta means involvement is there, sir. So Bhrajak Pitta and this Murdha, that is the basic stan of the Majja Dhatu. So that's why I wanted to correlate in that aspect.
I'm
I
sorry to
wanted
say,
to
very
develop an
vague.
approach, sir,
You are
towards
very
this.
vague and not pointing at the pinpoint. In all the diseases, obviously, dear, there is a role of Pachakagni. For a
Yes, sir.
presentation like this, vague answers are not acceptable. You have to be pinpointed. That means if Majja is there, because in Majjakshaya also there is a Shiryanti Eva Chastini. That means Asti Saushirya is told.
Yes,
So
sir,
Asti
definitely.
Saushirya
After
may be
Asti,
directly
then Majja
related or
Dushti is
indirectly
there.
related. But Basti as a choice and role of Pitta, Majja, I don't know whether you are trying to say about Sarakta Majja or Mastulunga Majja.
Sir, Mastulunga Majja.
You are not specific. Again, Mastulunga Majja, again, not related to hair fall. Definitely not. Okay.
Okay, sir. Okay.
Hello.
Hello, yeah, ma'am. Good afternoon.
Good afternoon, Dr. Namnita. First of all, I would like to appreciate you. You have collected all the theoretical data. But then I would like to second Sanjay sir. Because see, the ultimate use of now that you have completed 5 years of teaching, Dr. Namnita, the ultimate use of all this theory is only when you can apply it into practical aspects, isn't it?
Yes,
So
ma'am.
proving
Yes, ma'am.
something
Definitely.
theoretically is very vague if you cannot justify it when your patients come. For example, even the last slide that you show, the list of drugs, maybe if you are so particular about the involvement of asti, majja or pitta, you should be able to put this into practice. That is, when a particular, the
Yeah,
choice
ma'am.
of these drugs, you have given a list of drugs. Can you try that? Choice of drugs based on the clinical
Ma'am,
presentation of the patient?
actually, ma'am, I have tried to collect the data and definitely means I have tried on my part to formulate a protocol to treat a Khalitya patient on the basis of Asti Majja Srotodushti. So my approach towards this presentation is to develop or to formulate a treatment principle into that form, like in Asti and Majja Srotodushti.
Yeah, that is understood in your presentation. You have been constantly speaking on this. But the point is, every patient you mean to say can be treated with the same protocol.
No, ma'am. I
Every
don't
patient
agree
of
with this.
Khalitya.
No, ma'am.
Yes.
No, ma'am.
And the
Definitely not.
list of drugs, if you see that you have given in your slide, that includes
ma'am.
about 5 to 6 drugs, external maybe or internal maybe, isn't it?
Yeah, ma'am. Yeah, ma'am.
So
Yeah, ma'am.
when which drug in which phase, at least this you should have attempted
ma'am.
in your protocol.
Definitely, ma'am. Definitely. Because, ma'am, every patient come with a different stage of the disease and different presentations. So that's why I have told that Rasa to Majja, the Dhatus are involved, the Agni is involved. But definitely the treatment specifications is to be included into my presentation. That is, thank you, ma'am, for your positive response.
Only then the whole of the logic that you have proposed, a new hypothesis when it comes, if you cannot take it to the level of applications, there's no use. Then people don't agree hypothesis as such, isn't it? Just as Sanjay sir said, a new hypothesis should have proper references and practical applicability. Only then somebody maybe can take up this for a research work, because this is a new concept. Maybe you have to try on that.
Yeah, ma'am. Basically, I will try to apply it clinically, ma'am, on the patients.
Though before applying on the patients also, you should have a clear-cut idea about 5 drugs if you're naming. You should have an idea in which phase you are supposed to give which drug, so that if not you, somebody else also can try it, isn't it? So
Definitely.
trying, you have to convince people before they take up this hypothesis.
Yeah, ma'am. So, ma'am, according to the stages of the Vyadhi, I can formulate the line of treatment, the enlisted list which I have given into my treatment.
Exactly.
Yeah,
With proper justification. Only then this will be acceptable.
Yes, ma'am. Yes, ma'am. Okay.
Thank
Thank you
you.
so much, ma'am, for your inputs. Yeah.
Thank you, Dr. Navnita. Thank you, judges. Moving on to the next
Thank you, ma'am.
presentation, that is seventh presentation from Dr. Ramya Shetty, Assistant Professor Rasashastra and Vaishajya Kalpana from Sri Raghavendra Ayurveda Medical College and Hospital, Malladi Halli. The title of presentation is The Role of Rasaushadhi in Varnya. Over to you, Dr. Ramya.
Is my PPT visible, ma'am?
Yes, ma'am. Yes, ma'am. You can.
Good afternoon. Myself, Dr. Ramya Shetty, Assistant Professor, Department of Rasashastra and Vaishajya Kalpana, Sri Raghavendra Ayurveda Medical College, Malladi. My topic of presentation is role of Rasaushadhis in Varnya. So, introduction. In the world of Ayurveda, Rasaushadhis are revered for their ability to promote overall health and wellness. Rasaushadhis possess the unique property of Varnya, which is believed to enhance skin health, complexion, and beauty. Common reasons for the skin damage are external factors like UV exposure, pollution, harsh weather conditions, poor skin care routine, and internal factors like aging, hormonal changes, nutritional deficiencies, and other medical conditions. So, because of all these factors, there will be inflammation, increase in oxidative stress, which will leads to skin damage. So these are the rasadravyas which in told in classical text, which is having particular property as varnya. The vasmas of Abraka, Tutta, Manashila, Hingula, Swarna, Rajata, Anga, Shankha, Mukta, Pravala, Vajra, Nila. These are having particularly varnya property in the classical text. So I want to discuss the probable mode of actions of these rasadravyas. So first one is about detoxification. Because of Virechaka property of Tutta and Vangabhasma, Vishagna property of Swarna, Vangabhasma, and Akruta Tejaka Karma of other Rasaushadhis. There will be internal purification which will reduce the toxins, clear the skins in dullness of the skin and acne vulgaris and all. So next one about nutrient delivery. Micronutrients like vitamins and minerals are needed for the skin health. Vitamins like vitamin A, C, D, and copper, selenium, iron, and all. So Rasaushadhis provides essential mineral and nutrients which are beneficial for the skin to contribute skin repair and regeneration. So next, anti-inflammatory and antioxidant effects of the Rasaushadhis, like Bhasma of Mukta Shukti, Abhraka Bhasma, Rajata Bhasma will do the Pitta Dosha Shamana because of its Shita Virya. It will reduce the skin inflammation, redness, and pain, which is damaged by the free radicals. So next, anti-aging property. Rasayana properties of the Rasaushadhis will contribute to reduce the signs of aging. In one article, research article, it is shown that Abhraka Bhasma will reduce the oxidative stress by neutralizing the free radicals that can damage the skin cells, will cause signs of aging. And this Rasayana property of Rasaushadhis will help to maintain the skin elasticity and reduces the appearance of wrinkles and skin lines on the face. Because of Vata Pitta aggravation, there will be a mandala shaped patches like in Vyanga. So these Rajata Bhasma and Mukta Bhasma will help to reduce the hyperpigmentation and will help for the skin glow. Like other skin conditions like eczema, psoriasis, and all, there will be a blackish patch will be there after that. So Vrana, Ropana, Tabdosha Ramana, Karma of the Tukta, Gandhaka, Gairika, and Vanga Bhasma will helpful to improve the skin health by relieving the damage to the skin. And Bhasmas like Abhraka, Swarna Bhasma will act on Rasa and Rakta Bhasrotas by correcting Pitta and Rakta Dhatu. So it will purify the blood and improve hemoglobin level in the blood, which will help for the skin health. So for Rasaushadhis are told both for internal and external use to get Varnya property. In internal use, it is told as Swarna Bhasma along with Kumkuma Kesara can be taken daily for the Kanti Vardhana, and also Vanga Bhasma and Godugdha. Vanga Bhasma along Godugdha or Madhu as Anupana can be taken daily for the Kanti Vriddhi, and Swarna Bhasma along with Shanka Pushpi can be taken daily for the Tarunya Prapti. So external application of Varnya Lepa, which contains Rasaushadhis, the paste of Tutta, Rochana, Lodra, Priyangu, Kaliyaka, along with Madhu and Grita for external application, and the paste of Manashila, Tutta, Rasanjana. These two are told for Vyanga, and Mudukshar application is told for Chalmakela. So these are the benefits of Varnya Lepa. So common points which are present in the Rasaushadhis, which may contribute for the Varnya. Like rasa, virya of the dravya, and it is said as all the dravyas are said as having Tridosha Shamaka property in the prasadana. All will act on rasa and raktavaha srotas. For Varnya and Kanti Vardhaka, they are having Rasayana and Brahmana Karma, Hridya, Amahara, Vishagna, and Dosha Shamana Karma. So, for future research, that continued research and clinical trials are necessary to validate the efficacy and safety of formulations containing Rasaushadhis in cosmetic applications. The study have to be done for the combined effects of Rasaushadhis with Varnya Lepa Yoga containing the herbal ingredients. So, this is about my presentation. Thank you.
Judges for the questions.
Dr. Ramya,
Yes, ma'am.
as a first line of treatment, are you or do you suggest the use of Rasaushadhis itself in
Like
cosmetology?
no, ma'am. Once the whatever disease told it subsided, sometimes some like patches will remain after that disease also. So in that condition, we can go for a long-term intake of these associates along with Danupana.
How will you convince me that I should use Rasaushadhis and not Castaushadhis or Varanya?
Cast Aushadhis can be used, ma'am. Along with Cast Aushadhis, if we add Rasaushadhis because of Yoga Vaha property, then there will be a more benefits. So
do you have any clinical experience to justify or maybe based on researches that have been conducted that the use of Rasaushadhis enhances?
Based on research articles, I compiled these things, ma'am, not in practical application. Means in future
All
we can go
these,
for the
yes, the research papers that you have said are all critical analysis, review articles, isn't it? Any clinical trials?
the experimental studies have done on these, ma'am.
Comparison.
That's for Rasayana properties.
No, my question was, do you have any data for comparative statements of Rasaushadhis versus Castaushadhis as Varnya?
No, ma'am. That article I didn't get.
Then maybe you should try for that because you are in the Shastra department. And in today's world, using of Rasaushadhis is really a great question mark for all of us because of the toxic effects that have been known. Preparation of drugs are substandard, and we will be responsible for no harm if they are not prepared properly, isn't it?
Yeah, ma'am.
So then, with proper standardization, you should have a comparative data when you give such presentations.
Okay.
Sanjay sir.
Hello.
Hello, sir.
Yeah, all your presentations, as Madam asked, were publications were almost theoretical. So after the being a scholar or a faculty of Rashastra, you may very well know the JAMA article, which completely tried to assassinate the Ayurvedic Rasashuddhis by stating the concept of heavy metals and all. And to some extent, it was true also. And especially the second biggest thing was the death of the ex Vice President of India, that is Dr. K.R. Narayanan. The statement was said that he died due to the renal injury because of the some Rasashuddhis prescribed in Kerala for giving this. Even as a Kayachikitsa scholar, we shall not forget the very beautiful shloka that is Uttamu Rasa Vaidyastu. You all know that. But the present condition, as Madam said, Shubha Madam said, that everybody is looking at us with a very suspicious way that are these resolutions are safe or not, because the lead poisoning that happened in the JAMA article of this one. So if practically, if you are doing the Shodhana as told in the classics, then I am ready to prescribe. And if practical approach is there, except for the shlokas, what in theory it's told Varnya or the Chaya, Prabha, etc. Those are all theoretical words, and these animal experimentations, what you say in the name of river pharmacology, I don't agree with this, because already if it is antioxidant proved in antioxidant in your or free radical scavenging in your this one animal studies, it doesn't mean that it will act as a varnya or twacha or even prabhavarna etc. in Ayurveda practically on the human beings. But we should always take care that if a long term, the first question was itself very scientific from the madam, that how long you are going to give the rasaushadhis when you are not sure that whether it's heavy metals are there or not. So the question remains again that even a big company, existing a very huge company from Mumbai, I asked the CEO only that he said, I'll bring mercury 100% pure. Then I said, it's not the purity of mercury. It's always in Ayurveda, it is the samskara that we give with the castoshadis or some other medicines that will definitely detoxify, maybe because studies should be done that whenever the Astavida Shodha, Padara Shodha should be done, then only it should be there. So practically, we have to have some clinical evidences before presenting that whether these associations definitely help for the health of the skin or not.
But Swarna Basma, I mean, Kunkuma Kesara is also is taken for Varnya, sir. But Swarna Basma also, so that combination will works good for long term taking.
Yeah, Swarna Vasna obviously is for good for everything. That's why we give for Swarna Prashan also. But apart from that, the topic was Rasaushadis. Your topic was on role of Rasaushadis. That's what I was asking. For example, Rasamanik is there, Rasutamata Lepa is there, Arogyavardhini Vati is there, Gandhakarasan is there for skin. So how many articles have been published clinically?
Those are explained for based on like disease, sir. So here, just I have taken this for Varna property, not like especially for Kusta. So I excluded that and only this having Varnya as a classical reference, just that I have taken.
Okay, no problem. You have tried your level best on the basis of theory, but as Madam said, a lot of work is to be done to answer the critics to the modern science that we can handle or we can definitely improve the skin health by associates only if they are done in a classical way of purification and in Mandala Kala, what is told. That is only for a few days, then only we can do. Okay, thank you.
Okay, thank you.
Thank you, judges. Thank you, Dr. Ramya. Moving on to our next presentation, that is 8th presentation by Dr. Meenakshi Biradar, Associate Professor Kaya Chikitsa from Sri JVM Gramina Ayurveda College Hospital and Research Center, Theatre, Bagalkote. Title of presentation is Understanding of Ayurveda Trichology with the aid of Ayurveda Triskanda. Over to you, Dr. Meenakshi.
Hello. Hello.
Yes, ma'am, you're audible.
Ma'am, my PPT is visual, ma'am.
No, ma'am.
Is my PPT is visible, ma'am?
Ma'am.
Hello.
Yes, ma'am.
Is my PPT is visible, ma'am?
Not yet.
Hello.
Yes, ma'am, it's visible. You can proceed.
Yes. Thank you, ma'am. Good morning to everyone. My topic of presentation is understanding of Ayurveda trichology with aid of Ayurveda Triskanda, that is Trisutra. Yes, introduction. In today's era, hair care has become a subject of social medical importance, which is increasing day to day. As it is competitive era, people wants to be recognized with unique and distinct personality. As we all know, the purpose of Ayurveda is the Swasthasya Swastharakshanam and Aturasya Vikara Prashamanam. The concept of Trisutra has been specified in Ayurveda for the same purpose, as it includes the entire subject of the Ayurveda. Trichology is the science which deals with the study of hair along with its elements and their treatment. Kesha is defined as Kesha Mastake Shate iti, that means which grows on scalp, and a description about hair features of its healthy and diseased state and regimens and remedies for maintenance of its health and to cure disease are explained in different contexts of Ayurveda in scattered manner. Yes, now coming to the Kesha concept. The etymology of the Kesha is the Kesha originally has been brought about from the root that is Shi with Ach and Alok Pratyaya, which has been explained as Ke Shirshe Shate Iti. That means that which lies embedded on scalp. And Kesha, Bala, Kacha, Chikura, Kuntalas, Shiraruha, Ashrahas, and Murdaja, Shirshaja, these are considered as the synonyms for the Kesha. And when coming to the point of origin of hair, that is, there is no detailed description found in Ayurvedic classics regarding the production of Kesha in particular. But when compared to the upadhatu. In that context, we can understand that the kitta bhaga of the asti dhatu is helps in the origin of dhatu. And when coming to the point of the time of origin of that is time of hair production, the Acharya Charaka has Acharya Charaka considers that in third month, and Acharya Vagbhata considers in sixth month the proper time to development of the hair. And the number of hairs, the according to the Acharya Charaka and Acharya Vagbhata has considered 29,956 keshas. And when coming to the Shushruta, he has explained that innumerable hairs are there. And when coming to the hair nutrition, as we all know that Kitta Bhaga of the Asti is the is one thing which nourishes the hair. And that is what here I have considered that is a three skanda, that is three sutra. Here, based on that three sutra is mainly we can understand based on the prakrita and vaikruta avastha of the dosha dhatu prakriti of the person. Here, kesha as an indicator of the prakriti, that is health, as a health here. That is here using of the madhura rasa pradhana ahara sevana and dhumapana shiro abhyanga shira snana ushnisha dharana etc. These are considered as the patya hetus. And as linga, hair in its healthy state exhibits different features depending upon the dosha dhatu prakriti and sara of the person. And he as aushada, apart from daily activity protocol regimens, Ayurveda acharyas have mentioned the various procedures and dietary rules one can adopt in order to prevent elements and the elements and maintain a healthy state of hair. Here, few based on the nidhana, that based on the upakrama and patya. I have made one table, that is Patyeja Upakramas, like by following Svedana, that is proper Svedana, Nasya, Dhumapana, Virechana, Lepa, and Vamana, and Langana, Shiro Basti, Rakta Mokshana, Vanhi, Karma. And Patyeja Aharas like Purana, Grita, Shali, Yushak, Shira, and Vatsuka, and Kara, Vellaka, Shobhanjana is also there. And Ambra, Amalaki, Dadima, Narikela, Haritaki, Musa, and Ushira, Takra. And Patyaja Viharas like Chandrika and Gandhasara. And Apatya Viharas like Vegadharana, that is contaminated collyrium and contaminated drinks. And that is a day sleep is also one of the Apatya for the. And when coming to the aspect of the Vikrita Avastha, that is Kesha as an indicator of in Vikrita Avastha, that is as Hetu, that is causative factor for Kesha, or that is Shiro Roga Nidhana, that is whatever the causative factors explained under the Shiro Roga, those causative factor we can consider for the Kesha Vikaras. For example, that is Vega Dharana, exposure to the dust, exposure to the sun, overexposure to the sun, and Ati Madhya Sevana. These are we can consider as the causative factor for the Kesha Vikaras. And excessive intake of the Kshara Lavana Rasa. These are also main causative factor in case of the Kesha Vikaras. And Avalekana, that is poisoned comb. A poisoned comb, if used, that leads to hair fall. Along with that, that person may develop the headache, bleeding pores of hair, and appearance of nodular swelling on head. As a linga, that is
Thank you, Dr. Meenakshi. Over to you, judges, for the further questions.
No questions from my side.
Sanjay sir, please continue.
Hello. Hello.
Hello.
Yes, sir, you're audible.
Hello.
Yeah. How can you explain about in practical approach of your point what you said about this one? Your topic was on this one, no?
Sir, I'm not. Sir, I'm not getting on what.
No. Can you repeat your title?
Sir, understanding of Ayurveda trichology with aid of the Ayurveda three skandhas, sir. Hetulinga Aushadha.
Yeah. In that, if again the trichology comes, the health of the hair, there are many points. Okay. As discussed in the earlier presentation, from rasa to asti, rasa and asti actually, not rasa to asti, rasa and asti. And when it comes to rakta, it is just krimi that can definitely destroy the hair roots and all. So how can the Ayurveda Trisutra be helpful in the management of healthy or in the management of hair fall or early graying of hair, and also to prevent and for the good growth of hair also?
Yes, sir. We have to look for the dosha avastha as well as prakriti of the person. Based on that, we should go for the treatment or adopt the treatment modalities. Which dosha is get involved and which kind of prakriti that person is having. Based on that, we have to, sir.
Example.
Sir, for example, if the person is having pitta prakriti is means that person is more prone to develop the hair related disorders as well as palitya, sir. In that condition, if patient approached us means first and foremost we have to analyze the prakriti of the patient as well as the dosha avastha. And in some condition, we have to look for the vyadhi avastha also, sir.
No, I
For
got your
example, in
point. Pitta is
prameha.
there. Hetu is the pitta. And
Yes, sir.
linga may be pinjaratva or the kesha palita, or even later stage there may be kesha pata and palitya. So how do you approach your aushadha based on the hetu and linga?
Sir, that's what that based on the dosha, we have to select the drugs, sir.
Is it generalized statement or dosha vyadhi pratyanika? Is it just dosha pratyanika or dosha vyadhi pratyanika?
Sir, dosha vyadhi pratyanika.
That's what I'm asking you. How can you give one example? Either pinjaratva or falita kesha or kesha pata. Anything you can take and give an example so that you can do the vyadhi pratyanika chikitsa along with dosha pratyanika chikitsa for your point to be the health of the hair. Trichology.
Sir, in case of the palita, sometimes manasika causes will be there, sir. That is kama krodha shrama, that is ati shrama. In that case the increased deha ushma we can identify, and that may be vata, that is pitta pradhana. Based on that we have to treat.
I think you're not getting my question. If you went to Manasika Bhavas again, because Hetulinga Aushadha, you said Pitta, Vardhaka, Ahara, Vihara, increasing to Pitta, leading to Kesha Vikaras. So you have to give me a justification of how your Aushadha, that is the three skandha, the last skandha that is Aushadha, is going to work on Hetu and Linga based on how you reverse Vyadhi Pratyanika and Dosha Pratyanika Chikitsa. One example you have to give.
Yes, sir. In first, nidhana parivarjana is the points will come, sir. If that person is indicating in
patient has already taken nidhana now. Patient has already taken nidhana. There is lakshanas. You have to give aushadha now. Don't say nidhana parivarjana.
Okay, sir. Sir, if asti pradoshaja is there, based on that we have to select the tikta rasa pradhana, that is aushadas. And in case of the rakta pradoshaja, we have to select the that is Tikta as well as the Madhura Rasa Dravyas, Madhura Rasa Pradhana Dravyas.
Okay, but still I'm not satisfied. It's okay. No problem.
Okay. Thank you.
Dr. Meenakshi, since how long are you in this profession as a teacher?
6.5 years now.
6.5 years. Fine, very good. In that way, na, this presentation, this is just the level of presentation what a PG scholar can do. I feel so. See, as sir rightly said, when you go to a class, you teach which subject?
Kai Chikitsa.
Especially in clinical subjects like Kaya Chikitsa, when you discuss on hair, maybe hair growth, disorders related to the hair, you such an OPD, you get lots of patients coming to this these days. So you have concentrated on these three skandha, maybe Hetu, Linga, and Aushadha. Based on the presentations that a patient can come, you should categorize these, all these symptoms, the theoretical knowledge you have, you should try and evaluate the causes. And just speaking of a list of disorders, a list of causes, and then saying one word, Nidana Parivarjana. Now, when sir was asking you, you said if it is Rakta Pradoshaja Vikara. Where does other Rakta Pradoshaja? What do you mean by Rakta Pradoshaja Vikara? What is expected in the patient? A patient comes to you with hair fall. He's thinking that I had thick hair before, but since for the past 4 months, I have severe hair fall. Then, do you really go for Rakta Pradoshaja Vikaras? Do you assess?
No, ma'am, no.
Then, when you go to a classroom, you should convince your students with such things. Na? All this theoretical data will hold good only when you apply it clinically. So when a patient comes, what are the features he might complain of? What can be the nidanas? He might have just had a transfer, a change in the water quality, or many things, the environmental factors, his own prakriti, desha, all this don't you give importance? As Agni, all this do you give importance when a patient comes to you?
Yes, ma'am. Yes.
Then that is expected in your paper. Hetulinga, Aushadha, we wanted to listen that. And the category, you just went on telling about a list of disorders like, treatment modalities, Nasya, Anjana, Basti, Rakta Mokshana. When you will do all this in a patient with hair fall? Or maybe somebody who wants to have good hair quality? So naturally, in a presentation, a teacher with this year of experience, you should try out that. This is something very nice that has been done by the Aptas in the name of a great personality who was so clinical oriented. He has taught his students about the clinical approach. So this is the thing we need to follow, especially teachers. This is a special category for teachers, isn't it? So this is not only for Dr. Meenakshi, for everybody who has presented. We have to take our level of presentations to the next level when we are academicians. Even when we go back to our classes, only then we can apply this concept. So beautifully, you have taken all the theoretical concepts and go back today and try to categorize. It is just hypothetical, I understand. But then at least do a hypothesis so that when you come in contact with your patients, you will remember such things and try to apply it. Okay?
Yes, ma'am.
Thank you.
Yeah, I do agree. I do agree with madam because it is Dr. Meenakshi. Are you listening?
Yes, sir.
Yeah. Nobody in this presentation should get offended because it is the pain in our senior teachers that the upcoming generation should be taught practically so that they should believe in Ayurveda and our existing as a competent science because our government of India is trying so much to upgrade Ayurveda and also to bring it into mainstream. Because if I asked you about Hetulinga Ayurveda, this wonderful concept was there. For example, if you take hair fall, if you consider Raktaja Krimi, then if you take this Indralupta, where the patchy hair loss is there, in that condition, we have given just Nimbapatra Garshana. Just Garshana with Nimbapatra, and it's the best antifungal also. And also, if you give Arogyavardhani internally and Mahamanishadi Kashayam or Tiktamrita capsules, etc., the Hetu is there, which is the Krimivardhaka Ahara like Tila, Guda, etc., or Madhurasa. And Lakshanas are Indralupta, where there is a patchy hair loss. And Veshaja, the third point, what you are telling is, if you give Krimi Chikitsa, local application of Nimbapatra or even There is one type of snowy here which has a very fleshy leaf. So that also, if you do the Garshana on that patch, definitely in a week or 10 days, the patient will start getting small hair. So if you give such examples to the students, definitely a lot of things you told in this. It's already there. Okay, so a sincere request, nobody please don't get offended. We are just trying to be fair with our job. Thank you.
Yes, thank you.
Thank you, judges. Thank you, Dr. Meenakshi. Now, moving on to our next presentation, that is ninth presentation by Dr. Vidhi, Associate Professor Rachana Sharira from JS Ayurveda Mahavidyalaya, Nadiad. Presentation title is Unveiling the Mode of Action and Application Methods of Kesha Dravyas in Bhava Prakasha Nigantu. Over to you, Dr. Vidhi.
Yes, ma'am. Yes, ma'am.
Yes, Dr. Vidhi, you are audible.
Yes, ma'am. Actually, ma'am, my presentation is not going to sharing. Just a minute, ma'am. Ma'am, can you see my presentation? Hello, ma'am.
No, ma'am, no.
Ma'am, just 1 minute, ma'am. Ma'am, you have also my presentation. Can you share? Because here I cannot share properly. Ma'am, hello.
Just give me a minute. I'll just look forward.
Yes, ma'am. Yes, ma'am. Sorry. But just I can share. No problem, ma'am. It's okay. Ma'am, now can it show you?
Yeah, it's visible, ma'am.
Yes? Okay, ma'am. So, good afternoon to everybody. My topic is unveiling the mode of action and application method of Kesha Dravyas in the Bhav Prakash Nigantu. So, these are the overview of my lecture. And now going to for the introduction. So what is Kesha? So it promotes the hair health, which includes the hair growth, preventing hair loss and enhancing the quality of the hair. So in this presentation, I try to categorize the various medicinal plants that highlighting their therapeutic properties. And I try to find the gap between the traditional knowledge and contemporary hair care practices. And I also try to find the mode of action and application form of Kesha Dravyas, which is described in the Bhav Prakasha Nigantu. So these are the methodology and these are the 16 Dravyas articles which I found in the Bhavprakas Nigantu with the Rasapanchaka and a reference. On this, I have go for the final discussion. So first herb is the Haritaki. So it protects the hair follicles and scalp from the oxidative stress due to rich tannin and flavino acids, and it has also the exfoliating action, and we can use as an oil infusion, and also we can use of this herbs powder as a hair mask. Next one is the Glycyrrhizia glabra. So it is beneficial for the androgenetic alopecia due to the potential hormonal modulation, and also it has elevate the scalp itching and irritation. We can used as an oil infusion, and also its powder we can use as a hair mask. Then Ceralia caulifolia, it has combined with the UV light, and we can treat the alopecia areata because due to the photosensitizing effect, and also it has an estrogenic effect that influence the hair growth pattern, and also it enhance the melanogenesis. We can use as an oil infusion, and puva therapy, and Semicarpus anacardium, that has a potential effect on the melanin production. So we can use its oil. Then Melena arboreta. So it has a sebum regulation capacity. So we can use of this as a hair mask or oil infusion. Then Vitex nirgundo. So it has an analgesic property. So when the scalp discomfort is feeling, then we can use as a scalp compress treatment with a warm nirgundi decoction, which can pain relief and anti-inflammatory effect. Then Abris precatorius. So it has a analgesic property and potentially affecting on the hair growth pattern. So used in paste, oil, or hair treatments. Indigofera tinctoria. So it has a chemical-free alternative dye, and when we combine with the henna, it creates a set from the brown to black. And also it in hair conditioning. So we can apply as a hair dye. Then Eclipta alba. So it has a melanin production enhancing capacity, and also the repairing and regenerating capacity. So we can use as in oil form. Hibiscus rosa. It has hair conditioning and natural moisturizing agent, and it prevent the hair loss, giving the strengthening to the hair roots only, and it enhance the hair pigmentation and also delay the graying. We can use as oil or conditioner. Pterocarpus marsupium. So it is just wound healing and wound scalp repair capacity. So we can use as a serum. Then Semicarpus indicum, Sesamum indicum, that is based natural moisturizing and conditioning, and it has protect the hair from UV rays and preserving with its strength. So we can use as a scalp massage oil, and also we can use as a hot oil treatment. Then Musa sapenitum. So it is a best moisturizing and conditioning for the breakage and split end. We can use because it is a natural oil and carbohydrates are present, and it also improve the thickening of the hair due to the A, B6 and C and E vitamin, and also it has a presence of silica, so it gives a more elasticity to the hair. We can use with the honey or olive oil or yogurt, and we can use as a hair mask, and also we can use blended with the coconut milk and aloe vera for the scalp treatment. Next is the sheep milk. So it nourishes and scalp hair due to the more vitamins and minerals, and mainly it gives the strength to the hair shaft, and it also maintains the balance of the pH and soothe irritating the beneficially in the dandruff, eczema, and psoriasis, and it improves also the hair texture. We can use with the honey and avocado fruit and olive oil also as a hair mask, and also we can use the as a natural hydration and nourishment. So these are my discussion, and after that discussion, the sesame and sheep milk and banana has also the good result, which is not carried in routine practice. But by this understanding the mode of action and application method of this Kesha Dravya, modern practitioner can integrate the traditional wisdom into the contemporary hair care routines, and but also paves the way of development of new natural hair care products. Thank you so much, sir. Hello.
You, Dr. Vidhi?
Yes, ma'am, can I hear?
Yeah. Thank you, Dr. Vidhi. Moving on to the further questions by judges. Over to you, judges.
Dr. Vidhi, where did you get the references of all these from? I guess that should have been one slide.
Yes, ma'am. Hello? Yes, ma'am. Ma'am?
Yeah. Dr. Vidhi.
Yes, ma'am.
The reference of all the drug use of these drugs, where was it from?
Bhav Prakash Nigantu, ma'am.
Bhav Prakash
Nigantu. Yes, ma'am. 16 dravyas are described as a Kesha dravya, ma'am.
Yeah, he has used the term of Kesha only, na?
Yes.
How did you categorize it into antioxidant variety? And
ma'am, I studied so many papers and also the chemical constituent of that particular drug, and then I categorized this. And also,
then you should have included all this in your references. Why is that missing?
Yes, ma'am. Due to less time. Yes, ma'am.
No less time. If you don't refer, if you don't include, that is a crime. If you refer something and then you're not acknowledging the reference, that is not justified, isn't it, Dr. Vidhi? You must include it. Okay, in all. Maybe you needn't read every references, but at least you should tell these are my references. Only then that sounds authentic.
Yes, ma'am. Okay. Sorry.
And the way, no, that's okay. We are all learners. We learn equally, isn't it? That is just what I have noticed, nothing to get offended. And the way you have presented it, it feels as if you're following the reverse pattern. You are using a modern research and you're trying to prove things that has been, only one word of Kesha has been used in Bhav Prakash Nigantu, or any other things have been explained for all these drugs?
Yes, ma'am.
My question is, Dr. Vidhi, in Bhav Prakash Nigantu, there's only one word that is used against all these drugs. What does the original reference say?
Hello. Yes, ma'am.
What is the original reference of Bhav Prakash Nigantu, Dr. Vidhi?
Yes, ma'am. Ma'am, these all are found in Bhav Prakash Nigantu. I put a reference also, ma'am. In first 3 slide, ma'am.
Oh, your slides were not moving. Only one slide I could see. I don't know, it is my technical error or...
No, ma'am. Can you see, ma'am, now?
Yes.
Yes, so I put it reference where this herb is described and what are the ras panchak is there.
In Bhava Prakash Nigantu, is there a separate category called as Kesha, and these drugs have been mentioned in that?
No, ma'am. In individual varg, it is described. Just in like that Haritakyadi varg, there is a one Haritaki is described. One function is there, ma'am.
Why didn't you tell all this? This is something, a different version, na? Now, as per your presentation, what I understood that Bhav Prakash Nigantu has given a special varga called as Kesha Varga and has explained 16 drugs.
No, ma'am. Just I found this in 16 herbs, that word Kesha, ma'am. Especially.
Okay. Especially. And only one word, Kesha, only was used.
Yes, ma'am. So that's why I took these references, ma'am. Already I mentioned with the page number and reference also, ma'am.
And just in case you publish this work and somebody reads this, he can directly go and apply this as a hair pack for Kesha, is it? I have Ballataka in my house. I have Abras precatorius with me in my lab. So I'll prepare Taila and then apply to my hair so that it is Kesha.
If there is a need to sodhana or anything, then we have to do. Like
then.
Yes.
Yes, I get your point. Then all such things should come in your presentation or your publication. Okay? Whenever you present something, there is no. Are there only 18 drugs as per you in the whole of Bhav Prakasha Nigantu which have Kesha? Or there may be many more?
No, ma'am. All only are these 16 is more. The word is written that Kesha.
In these 16 drugs, at least there should be one line that based on when you publish such things or maybe when you present such things, it should always be followed with you because you are specific about method of preparation also, method of application also. You have suggested about Taila, you have suggested as hair pack, you have suggested many other things. So then if you present it like this, people can get a wrong idea also. So you have to tell at least one line that the method of, because there are many spurious drugs also, dangerous drugs also, which can create problem, isn't it? So try to take this presentation to that level. And all this must have been come in one slide maybe. That case here refers to so many activities, and depending on the cause, you can interpret different things, which has been included in the Nigantu. That is why it is used so many drugs. And the modern researchers say that should be the way of presentation. Okay.
Okay, ma'am. Thank you, ma'am.
Okay, doctor. Sanjay sir, over to you.
Yes, ma'am. Thank you.
Yes, sir.
Jai Shri Krishna.
Hello. Yes, sir.
I said Jai Shri
Jai
Krishna.
Shri Krishna, sir.
Okay. Right from Jamnagar, I'm missing this one. So yours was a good collection of, as Madam said, it's a collection of theoretical way. Are you practicing also?
Yes, sir.
You are in Dravagam department? Sorry.
No,
You're in Dravagam
no,
department?
sir. I am from the anatomy department, but I am also working as a quality coordinator and also from the different part of NABH and like that. So, sir, I am doing some practice, but not only like an OPD and also like that, but giving to
But
suggestion of
being a lady
and
doctor,
also yes.
being a lady doctor, you may be getting lots of cases of hair related
Yes,
issues.
sir.
Have you
Yes,
tried?
sir. Yes, sir. I have tried for the banana and also I have tried for the sheep milk on myself also, sir.
Sorry, what did you try?
Banana and sheep milk, sir, which is described in the Bhav Prakash, sir.
Which one?
Banana, sir. Banana.
Okay. What part of banana?
Sir, pill. So just I give you the
Fruit
slide.
peel?
Yes, sir. Yes, sir. Yes, sir. With the olive oil, sir. I use with the olive oil and this banana pulp, and then I apply as a hair mask, sir. And
No,
I
is
got
it a pulp or peel? You are confusing again. Is it a pulp or peel?
no, sir. Pulp, sir.
Fruit pulp.
हाँ, yes, sir.
रेफरेंस है महाप्रकाश में इसका?
नहीं सर, इसका रेफरेंस नहीं है. इसका रेफरेंस सिर्फ इतना है कि बनाना केशर द्रव्य है सर. कैसे यूज करना है वो सर मैंने देखा है सर. ऐसे मैश्ड बनाना मैंने मैश्ड किया था और उसके साथ ऑलिव ऑयल मिक्स किया था सर, और उसका मैंने हेयर मास्क अप्लाई किया था सर. एज अ हेयर मास्क अप्लाई किया था सर. 15 to 20
What are the results? How many
sir,
days?
I got found the thickness of my hair, sir.
How many days you did it, and how many frequency? How many days, like weekly
Sir,
one?
I just yes, weekly one for 5 times, sir. Then I got matlab I can feel my hair is thick, sir.
Have you tried the same formula on any other patients?
Yes, sir. One of my because I am doing in Panchkarma department also as a MO. Here, so I try on one mixture, or also sir found that the thickness and elasticity also sir improved.
Interesting.
Yes, sir.
Is there any reference of olive oil in Ayurveda?
Huh, sir?
Olive oil, any reference in Ayurveda?
No, sir.
No. Okay.
Okay, sir.
Fine.
Thank you, sir.
Thank you, Dr. Vidhi, and thank you, judges. Now moving on to our next presentation, that is 10th presentation by Dr. Sulochana B. Shri Siddhi Vinayaka Rural Ayurvedic Medical College, where she is an Associate Professor of Kriya Sharira. Title of presentation is Concept of Yavana Pidaka in Ayurveda. Over to you, ma'am.
Good morning, ma'am. I'm trying to share the screen. My screen is visible, ma'am?
Yes, ma'am, it's visible.
Okay, ma'am.
You can proceed.
Good afternoon, everyone. I'm Dr. Slochna, Associate Professor of Department of Kriya Sharira, Sri Siddhi Vinayaka Rural Ayurvedic Medical College, Harugeri. So today's my topic is concept of Yavan Pidika in Ayurveda. So first we'll go for the introduction. Skin is the mirror of our state of health.
Its appearance reflects our age, health, and even state of the mind. Twak, according to Ayurveda, is not only the outer covering of body, but it is a jnanendriya which encompasses the body from within also. Yavan Pidika is such a disease which is affecting the facial beauty. In Ayurveda, the Yavan Pidika is correlated with the acne vulgaris, and it is explained in one among the Shudra Rogas, which occurs due to vitiation of the Pitta, Kapha, Vata, and the Rakta doshas. Yavan Pidika is an eruption resembling the Shalmali Kantaka on the face of young men and women, called as Yuva, and its Pidika is Yavan Pidika. The synonyms for this used by our acharyas is Mukha Dushika and the Tarunya Pidika. Next, the acne vulgaris. It's a skin condition that occurs when hair follicles plug with oil and dead skin cells. It's an inflammation of the pilosebaceous units, and it's characterized by development of comedones in the form of papules, pustules, and nodules, and less commonly cysts also. It's most common in teenagers and the young adults. Any skin condition can have the impact on a person's psychological well-being and the social life. As in by the Ayurveda, we have the definition of swasth is a person must be free from both physical illness in addition to being joyful, mental state to be considered healthy. So acne is the most prevalent skin condition encountered globally. Across the globe, acne affects 80% of individuals between the puberty and 30 years of the age. It's having more psychological impact also. So epidemiology of the acne vulgaris we can see in the picture here. So in the teenagers, maximally females are going to have the 60% effect and the males are going to have nearly about 70%. And the 20s, the females are going to have the 50% and percentage of the acne, and male is going to have the 40%. Similarly, it's going to be decreased by 30, 40 or the 50s. In 50s, the females are going to have only 20%, and males are going to have the 10% here. So if you go for the Nidana aspect of the Yavan Pidika, so we can classify as Ahara, Vihara, Mansika, and the Kalaja and others are the triggering factors here. So in Aharaja, we have the excessive use of Ati Katu and the Madhura Rasa, Guru Ahara, Ati Snigdha, and Dugdha Varga Ahara, specifically the milk products, what we are getting to this, and the oily foods also. In Viharaja, the Vega Dharana, Jagrana, Nidra, Upwasa, and the Atapa Sevana. Mansic causes here are the Shoka, Shobha, Krodha, Santapa, Swabhava. All this leads to the Pitta Vikritis. And the Vata Kapha are vitiated by the Shita Gunas of climate that comes in the Kalaja. And the Ushna Kala vitiates the Rakta Dhatu also. And the climate when we are having the more of the humidity. And the Tarunya, Madhyama time of the days. And the Grishma and the Sharada Ritu. The triggering factors here are the hormonal changes and the cosmetics. So hormonal changes, the females during having the pregnancies and usually during the menstrual cycles also. Next is the Samprapti. So what are the positive factors of the Nidana is there? It leads to vitiation of the Pitta, Kapha, Rakta and the Meda Dhatu also. So all these going to affect the Rasarakta Dhatu Agni Vaishamya. Then all this leads to Rasarakta Medo, so Svedavaha Sroto Dushtis. So vitiated doshas get Sthan Samshraya here in the Mukha Pradesha and the Twaka and leads to Utpatti of Shalmali Kantaka Pidaka, accompanied with the Shula, Daha, Vaivarnya, and a Mero Garbhata. If you go for the Chikitsa Siddhanta here, so first line of treatment according to Ayurveda is a Nidana Paljana, Nidana Parivarjana. And next is the Shodhana Chikitsa, which includes the Panchkarma here. Then Shamana. Then we have the concept of Chikitsa according to KSD concept, that is the Koshta Srota Dhatu Shuddhi has to be done. For the Koshta, we can go for the Pachana, Pitta Shamana, and Vatanulomana. Srotas, Rasa Srota Shuddhis, Rakta Shuddhi, and Rakta Prasadana can be done here. Dhatu wise, Mamsa and the Shukra Pachana has to be taken. Then if you go for one by one Shodhana Chikitsa, so here Virechana is specifically indicated for Pitta dosha and Pitta Samsarga doshas. And Acharya Shushruta mentioned Virechana in the Kushta Prakarna also. And vitiation of Rakta leads to appearance of symptoms on Tvak and Mamsa. So, and Kapha, Pitta, Rasa and Rakta are involved here as the doshas and dushyas. Acharya Charaka also indicated it in Virechana in all the type of skin disorders. And these Virechanya Dravyas expel the excess of Pitta, which is vitiated from the Buddha Marga. And Pitta Rakta having the Ashrayi Sambandha. So Virechana is more effective here as the Pitta and Rakta are the doshas here. And Virechana act as Sarvdehika Shodhana Karma also. So next is the Rakta Mokshana. Shushrutaracharya indicated Rakta Mokshana in the Shudra Rogas, and Vankpata Chakrapani also indicated it in Yavana Pidika. So Rakta Mokshana by Jalauka helps to these Jalauka sucks the vitiated Rakta, and its saliva contains the hirudin and the kaolin, which is anti-inflammatory, antimicrobial, and it is going to promote the sluggish wound healing also. Next, Vamana. Vamana is the main line of treatment indicated for Kaphaja disorders. So, as Shushruta also explained, particularly it is beneficial in the Yavana Pidika, and it expels out toxins present in Rasadi Dhatus and purifies dushyas of the Twaka.
Thank you, Dr. Sulochana. Your time is up. Over to you, judges, for the further questions. Judges, over to you for the questions.
Dr. Sulochana? Hello. Hello. Am I audible?
Dr. Sulochana, please unmute yourself.
Yes, ma'am. I'm audible.
Do you have any clinical? Yes, yes, you are. Dr. Sulochana, any clinical experience of treating Yavana Pitaka?
Yes, ma'am.
Achha, what do you do when a patient comes to you? Out of all these chikitsa that you have explained?
Okay. Madam, I go for this courses with the Dhatu Shuddhi practical wise. And I first treat for 1 week or 10 days for the coaster, then I go for the slotas and then for the Dhatus, ma'am.
Achha, could you explain with medications, please?
Hello.
Huh. Could you explain with the examples of medications, please?
Yes, ma'am. First, I'm going for the Gurichari or the Amrita Gugulu. And then with this Amrita Gugulu, I go for the Mustadi and the Sarivadi. Next, again, we will, this first 15 days only, we are going the Chandan. 15 days, ma'am. 10 to 15 days.
Nothing external during these first initial 15 days? Only
no,
internal?
Internal with external, madam. Jalauka Aucharna we are doing and with the lepas, madam. Externally.
Lepas like?
Lepas, mein Shalmandir lepa is there, ma'am. Or Lodra lepa we are using.
Okay. And in your these prescriptions, what is the doshas, what you have considered?
Dosha, ma'am, say Vata, Pitta, Kapha and the Rakta. Srotas are the Rasava Srotas.
All three? All Vata, Pitta and Kapha?
No, ma'am. Specifically Pitta and Rakta is there, ma'am.
So in all conditions, this will be your first line of treatment?
Yeah, ma'am. Almost.
And what is the coaster? You said me it was the coaster that was targeted.
Yes, ma'am.
Why and how with your this prescription? Can you elaborate?
But why means the costa here, the pitta is vitiated, ma'am, initially. So we have to maintain the flora of the gastric flora has to be maintained. So for that purpose, we are going with the Chandana Asava, ma'am, here. Chandana or
What
Ushira
Chandana
can
Asava
be
there in
given
your 15? No, in your prescription, you didn't tell me Chandana or Ushira. You began with Guduchadi and?
Ma'am, tablet wise, I'm going to give you the Guduchi, Musta, and the Sariva, and the side effects, I'm going to do the Chandanadi, ma'am.
So, how many prescriptions you will have to a patient?
Only one prescription, ma'am. That to one Chandana Asava, one Guduchi tablet, one Musta, and one Sariva. 3 tablets plus 1 syrup, and 1 Lepa, ma'am.
And after 15 days, how will you change?
I'm going to change with the Khadiradi and ma'am, and the Tulsi Adi I'm going to do. The same continuation of the Guruji.
Intention of this?
Ma'am, I'm going to purify the Rakta next. First, I'm going to do the Shrotas wise. Next, we are going for the Rakta.
And then, when will you change? No, I just wanted to know the logic of the prescription. That's all. The theoretical that you have said me. How will you apply it practically based on different cases? That is my question. I just wanted you to give me examples.
And the same,
and after that,
the way we are going to follow, ma'am. The next, I'm going for the Nimbadi tablets, ma'am. Nimbadi with the Lepa and Jaloka. Weekly once, I'm going to apply.
And when a patient has lots of...
Yes, ma'am.
Yes, please continue.
If the patient is going to have the cystic acne, then this Jaloka is very beneficial for it.
How many acne is expected in a patient's case?
Number of acne, ma'am.
Yeah, number of lesions.
Number of lesions, it may be vary from 5 to 6, ma'am. If the cystic is there, it will be big in size.
Okay. And then on how many lesions, how many Jaloka at a time?
At a time, only maximum 2 I have tried, ma'am.
Maximum 2.
One after one.
And
one after one.
Every week when you apply, it will be on different lesions, is it?
Yeah, ma'am.
Okay. And you are quite confident that with this, how long will it take for the patient to... And when will you give Shodhana?
Shodhana, ma'am, depends upon the patient. Sometimes I go for the Nitya Virechana also by just the Tribal Kleha. That also helps.
For how many days?
Initially 15. Initially 10 days, ma'am.
Okay.
But this I get the results in 1 month, ma'am, almost.
Okay. Maybe you could have gone with this in a reverse order. This clinical experience that you are saying, with one example, if you could tell us that how you have applied. Then see, these days, if you go to students and speak like this, what you have presented, it is difficult for them to take things. And that is why we have a new curriculum coming up. You are teaching which subject?
Kriya Sharira, ma'am.
Kriya Sharira. So you already know about the new curriculum, the competency-based curriculum. You have so many teaching methodologies, at least after following. It's the second batch you have completed now, if I'm not wrong. Since 2020 batch, you have taken the new curriculum and you have already completed 2 years. 3 years of teaching, 1.5 plus 1.5. And after this also, if we expect this level of presentation, maybe our expectations have increased now, both from teachers and presenters' point of view. We can go the other way around and try to explain things so that to the world, when we explain this in either presentation mode or publication mode, it should be more acceptable. Okay.
Okay, ma'am.
Thank you.
Okay, ma'am.
Thank you.
Okay, ma'am. Thank you, ma'am. Thank you.
Hello.
Hello.
Am I audible?
Yes, sir. Audible, sir.
Okay. So you said Nitya Virechana with Trivrutlaya. How much dosage? How many days?
10 days I'm giving, sir.
Dosage of Trivrutlaya?
10 grams, sir. 1 spoon, I'm just telling to the patient, sir.
Any Anupama
Daily
you are following
night,
specific
sir.
or just hot water?
Daily night, sir.
Okay.
Anupana Ushnajala, sir.
No, if you give 10 grams in the night, don't you expect his sleep will be disturbed? Any experiences
No,
that a
sir.
patient has got some
No, sir.
Vegas or something like that? Because we give Virechana we give Virechana, no? Whenever we give Virechana, it's given in the morning.
Yes, sir.
And giving night as a laxative 10 grams of Tiruvurkleha, is it practically or just telling theory? Have you given to the patients?
No, sir. I have given to the patients, but I didn't got any such complaints, sir.
Yeah, and what about this one? For acne vulgaris, you said, na? If you have you tried the other way, as madam said, that you are given first Virechana and then for Shamnaushadhi? Nitya Virechana can be given just with triple also, or even with
Yes, sir.
Vibhaktikar also, or any other
Yes,
thing.
sir. Yes. Yes, sir.
So, logic behind choosing Tiruvurkleha.
Depends on the patient, sir. If the I check for the pitta prakopa, if it is more the patient's complaints of the pitta vitiation or the more as a he's having some hyperacidity complaints and all. So depending on that, I'm varying, sir, medicines. So sometimes we can give, as you say, Trifla can be given or this Trivulcleha can be given.
So, in
Allopathic
acne,
Chudna can also be used.
yeah, in
Yes, sir.
acne, what do you think the dosha pradhanta is there?
So it is usually pitta and rakta both are involved, sir.
Pitta and Rakta.
Yes, sir.
Okay. So, have you heard about some ladies complaining of acne during the menstrual cycle?
Yes, sir. It's
Hormonal.
hormonal disturbance is there, sir.
Is your approach same in that also?
No, sir.
Then what will be your approach in that condition?
So there I'm not going for Virechana, sir. Only Shamanaushadhis I have tried.
So let us take in this way: if pitta is there in different conditions, like Amshansha Kalpana, that is your Vikalpa Samprapti.
Yes, sir.
Yeah, there are many Tikta Dravyas like Patola, Nimba, Manjashta, Sariva, many things are there. Okay, so
yes, sir.
Can you try to explain that based on Amshamsha Kalpana, whether it is Kevala Pittaja, Pitta Raktaja, or sometimes Pitta Kafaja, sometimes if there's more pus and all. So which drug to apply
It
where?
depends. It depends, sir. According to Amshamsha Kalpana, it may be Pitta
No,
Raktaja
you
or
give
the
example.
Kapha. Yes, sir.
So you create a case, and then try to explain hypothetically for
Yes, sir.
Kevala Pittaja what happens, Pitta Raktaja what will you give, and for if there is association of Kapha, it's at the bigger size with more pus, no?
Yes, sir. If
After the
Kapha is
pasa
involved,
takes place.
the Kapha is involved, sir, the more pus will be there, the size will be more.
What is the drug there?
Hello.
Yeah, question
Hello?
is very simple. Kevala Pittaja.
Yes, sir.
Hello.
Hello, sir.
Question is very simple. Kevala Pittaja, Pitta Raktaja, and Pitta Kapha.
Okay, sir. So there we can use the
Drug,
Varunadi
how will
Kashaya,
it
sir.
be?
So there we can use the Varunadi Kashaya as it is having the Kapha Medahara qualities, sir.
Varunadi Kashaya.
Yes, sir. As Kapha is involved and it's having the Kaphahara qualities, sir. And we are having there, if the Kapha is there, Kapha is vitiated, we are going to have the cystic cantinus, sir. Hello. I'm audible, sir.
Thank you, Dr. Sulochana. Thank you, judges.
Thank you, ma'am.
Moving on to the next presentation, that is 11th presentation by Dr. Manjula Heggai, PhD scholar, Swastavritta and Yoga, SDM College of Ayurveda and Hospital, Hassan. Title of presentation is Critical Interpretation of Ahara in Protection and Promotion of Hair Health.
Hello. Thank you, ma'am. Am I audible, ma'am?
Audible.
Yes. Just give me 2 minutes, ma'am. I'll share my presentation. Hello, ma'am. Is my slides are visible, ma'am?
Yes, ma'am. You can proceed.
Okay. Thank you, ma'am. Thank you for giving me an opportunity to present my views regarding Ayurveda, Trichology, and Cosmetology. My topic is critical interpretation of Ahara in protection and promotion of hair health. So, hair health is one of the distressing condition for a significant number of men and women. Irregular dietary habits, deficiencies of vitamins and minerals, inadequate sleep, lack of scalp hygiene, fungal infections affect the quality of hair and invites the problems like dandruff, thinning of hair, early baldness, and premature graying of hair. So in Ayurveda, we get the reference like excessive use of lavana rasa, that is salty foods, katu, ushna, and tikshna ahara leads to akala khalitya, palitya, valipalita. So healthy hair is described as hair that has luster, which is smooth, long, silky, bouncy, with good volume, and with no evidence of balding. Each hair is composed of columns of keratinized epidermal cells bonded together by extracellular proteins. Ayurveda gives importance to the maintenance of healthy body as well as curation of disease that can be achieved through the Swastavritta Paripalana, that is prevention of disease and the protection of health or promotion of health. So here Ayurveda has a treasure of knowledge where which includes preventive, protective, and promotive measures for hair health. So, other formulations like Dinacharya procedures, for example, the Shiro Abhyanga Pratimarshan Nasya, and also the Chikitsa, and also the Ahara and the Rasayana Prayoga. These are the some expensive methods or the for the hair care. There are a lot of areas to be explored in the field of trichology in Ayurveda. One of them is Ahara Prayoga through the Ahara Prayoga to improve the Kesha Arogya. So concept of hair in the Ayurveda. So as per Ayurveda, the Dharana and the Posana are the main functions of Dhatu. From Rasa Dhatu, each of the consecutive Dhatus gets transformed with proper Dhatwagni. While the Prasada Bhaga and Kitta Bhaga of Meda Dhatu, then the Prasada Kitta Bhaga of the Asti Dhatu is formed of Madhya Dhatu is the Kesha. So this is the part.
I have to ask Dr. Vidhi to mute. There's a lot of disturbance.
We'll see the hair growth physiology. Hair growth occurs in the three phases: anagen phase, catagen phase, and the telogen phase. Anagen phase, this determines the length of hair. Most of our scalp hair is in this anagen phase for almost about 7 years until some unknown factors push the hair to go into the catagen phase. Catagen phase, in this phase, the hair follicle stops growing and gets converted to a clubby hair. Then telogen phase, this is the last phase of growth of hair follicle, where the follicle goes into dormant resting phase and hair shaft is shed off. So here we see the growth of hair, then we try to interpret the ahara importance in the hair health. So according to Acharya Kashyapa, according to Acharya Kashyapa, ahara is said to be Mahabheshaja. So one among the Trayopastamba. The health and the disease of an individual depends on the food he is consuming. As hair is the growing part from the scalp, it needs proper nourishment. If the nutrition is not proper, the growth is disturbed and arrested, and the hair starts to fall off. Acharya Charaka advised to reduce the use of kshara, lavana, ushna, tikshna and katu ahara, which will lead to the premature graying of the hair and also the early falling of hair. So we have to adopt such a foods which includes the nitya sevaniya aharas like godhuma, yava, mudga, grita, jangala mamsa, amalakki, mudga and tila, which along with normal diet, they will promote the hair health. As they are, when we analyze the nutritive values of these dravyas, they are rich in protein, biotin, vitamin A, vitamin C, omega-3, 6 fatty acids, zinc, selenium, which nourishes the scalp and improves the hair health. So objectives of this study, here the literature available on ahara and hair health is analyzed, and critical interpretation of ahara in protection and promotion health. Then methodology, this study is completely based on literary review of Ayurveda Samhitas, Google Scholar and the published research articles where the possible critical interpretation has been made between the collected information and is presented in a systemic way. So here observations and results. Critical analysis of ahara and its components. See, first we will see the protein rich foods or the nitya sevaniya ahara, which are rich in protein, mudga and yava godhuma, which are rich of protein. Among the protein, we need biotin for the hair growth. So biotin is a vitamin B complex, and which is important for the skin and the hair, which helps the body to synthesize amino acids, which later transform into keratin. So a protein which is found in the hair. So biotin transports the oxygen to hair follicle and is promote the hair health. Egg is also the best source of biotin, and both the keratin and biotin are beneficial for the thin and frizzy hairs. So vitamin A, vitamin C, vitamin E, vitamin B12, omega-3, 6 fatty acids, zinc, selenium, iodine, magnesium, minerals are going to enhance the hair health. So these contents we found in our amalaki, which is a vitamin C rich food, which is always going to nourish our body, along with which is having the
Thank you, Manjula Hekar. Over to you, judges.
Dr. Manjula. Hello. Am I audible? Hello. Hello.
Hello.
Dr. Manjula.
Yes, ma'am. Yes, ma'am. I'm here. Just 2 points remain, ma'am. Shall I explain, ma'am?
I guess your time is up, Dr. Manjula.
Ma'am, in between that disturbance was there. Ma'am, just 2 points, ma'am. Ahara as Rasayana Prayoga and one product I want to explain, ma'am. Just that's all.
Okay, carry on.
Yes, ma'am. So ahara as Rasayana, I'm not telling Aushadha as Rasayana, ahara as Rasayana, that includes Nitya, Kshira and Gruta Abhyasa. So early falling of hair and graying of hair indicating the early aging process. So Rasayana is reversing the aging process. So ahara as Rasayana can reverse the hair fall or the aging process, which is having the antioxidant property. And along with this, the anti-androgenic factors like 5-alpha reductase inhibitors or the DHT blockers, that rich foods, even our Grita, Amalaki and almonds, these are all having the DHT blocker property. So they are going to enhance the hair health or they are going to promote the hair health. So when we compare Aushadha, Ahara is the best absorbed in the body. So we can give as a dietary supplement along with treatment these Ahara Dravya nutritive products, then we can definitely enhance the hair health. Thank you, ma'am. Thank you for giving me and explain my views.
Dr. Manjula, you are from the Swasthagata Vibhag, isn't it?
Yes, ma'am.
Have you tried any new products on this hair fall?
No, ma'am.
Hair
Just
health.
I am preparing a nutritive product which is rich of vitamin A, vitamin C from the Ahara Dravyas. Then I am going to do its nutritional analysis. Then I am going to.
When a patient comes to you, you can't just tell him use more of Yava, use more of Goduma. Is this the way you want us to explain?
No, ma'am, we can't tell. That's why I'm planning to prepare a nutritive product which is rich of these contents. Then we can easily advise them to the patients, ma'am.
Already, at least in your got your point. Thank you.
Yes, ma'am.
At least in your presentations, you should stop telling in further presentations. You should stop telling just mere such things blindly. So, though in the classics we get such references, how can it be implemented to the clinical level? That is expected from you, na? So maybe some combinations which we use in our daily life, how are we supposed to do them and enhance them? That was expected from your paper, maybe.
Yes, ma'am. Actually, what happened directly, we don't get the reference like Kesha Dravyas in Ayurveda, we get, ma'am, in Charaka Samhita. But Kesha Ahara Dravyas in Ayurveda, we don't get any reference, ma'am. So, based on our yukti, we can implement the Nitya Sevaniya Dravyas because long term usage can also harm our health. So, only I concentrated
Dr.
on.
Manjula, that is what I'm telling you. We agree on this fact. And today's patient want to listen all such things from us. They don't want us to recite some slokas, neither the students nor the patients. You just tell them from your references, what I understood is, apart from Amalaki, even if I tell him Amalaki, in this season, where will the patient find Amalaki from?
Ma'am, Amalaki.
In Nitya Ahara.
Other, ma'am, like we are prepare the food preparations, we can store for longer period, then we can ask.
For example.
Ma'am, even Amalaki, Chavanaprasha, ma'am, Amalaki, simple Amalaki Avaleha with Guda and Amalaki, we can prepare, ma'am. Amalaki, in my PhD study, I'm preparing Amalaki biscuits, ma'am. So, biscuits we can preserve for longer period. So, such foods we can prepare.
Have you heard of a concept called Murabba?
Yes,
the Guda Amalaki that you're speaking. So, all such things exactly. I wanted your presentation to have all such things. That is my point.
Yes, ma'am.
So, when you present, you could have at least presented this, no? So because you're speaking about Nitya Ahara, Goduma or Yava, if you ask somebody to use it daily for a further use in a higher ratio, what will you suggest? How is he supposed to take Goduma apart from his normal diet?
Ma'am, Yava and Goduma already we are using, ma'am, because that's most of the staple food, ma'am, in our Karnataka.
No, in Karnataka, I don't think so. People use more of rice. Where do they use Goduma or Yava daily?
North is of this, ma'am. South is rice, ma'am. In North Karnataka, we roti or
chapati. Then you're not necessary. I am not South Indian. I am not from south of Karnataka, but I am your patient. I am from far away and I'm asking you. So what will you suggest me?
Ma'am, I will prepare the nutritive products in such a way that, ma'am, I can prepare the dietary supplement and I advise the patient, ma'am, because
until you prepare, Dr. Manjula, so until you prepare your product, we will have to wait to advise our patient. Is that what you want to tell me? Yes. Can't you tell me one or two recipes which I can use in my daily life?
Amla Murabba. Amla Murabba word you may be not knowing. That's why that Guda preparation like Chavanprasha we can prepare the Amlaki preparation, ma'am. I thought you that Amla Murabba in North Karnataka we are preparing, ma'am. So that word may not be suitable in the presentation. That's why I have not included, ma'am.
Right? No, that is my point. That is my point. In your presentations, kindly include. If people don't know, they'll go back and see because they are very well available in the market.
Yes, ma'am.
Today, everybody has it in his hand. So your presentation should not be theoretical alone. Yava Goduma recipes which the patient can prepare and which you can find on the internet. chilla that you say, na? Everything, there are so many recipes which people use around the country. So try to incorporate in further presentations and don't make it only theoretical. Okay?
Yes, protein rich bars from Udgar that can also be prepared, ma'am. I'm continuously trying the nutritive products only, ma'am. I'm preparing all those. So just I was not knowing that putting those words in the presentation will be more acceptable or not. That's why I thought I will explain.
It will surely be acceptable. At least you can try and do it, na? Accepting or so many hypothetical things have come up in the presentations today. But then you have to at least put forward your ideas. We don't want to listen to theoretical aspects from at least teachers. You're not a PG scholar or a PhD scholar is presenting. You're teachers who are in clinical practice, so we expect such presentations. Thank you, Dr. Mandela. Over to you, Sanjay sir.
Hello, Dr. Manjula?
Yes, sir.
Yeah, you are from Swasthata department.
Yes, sir, Swasthata department. Sir.
Yeah, when there was an interesting thing you told about some biscuits from Amlaki.
Yes, sir. Amlaki preparation.
Okay. So, are you going to add any preservatives for that to be staying for a long time?
Sir, for this amla murabba and this gudapaka preparations, we don't need any preservatives.
No. My point is only for the biscuits.
Biscuits, sir. Actually, if we store them for 2 months, then we don't need preservatives, sir. If we need more than 2 months, then we need a preservative, sir. For that, we can use the natural preservatives, which are having less harmful effects, sir.
See, practically, if Goduma and all is used in the northern part of India, like Punjab and all, here in North Karnataka, we use most of Jawar and Godum also.
Yes,
and
sir,
even Java is very common here.
Yes, sir.
Okay, so you should practically try to, if you want to make a formulas,
yes,
like protein powders, or if you want to make some laddus like mudgadi, modaka, etc.
Yes, sir.
Even in our part now, there's a season of this what we call from wheat flour fried and made into laddus like tambittu, we call it as aralittu like
yes,
that.
Sir, yes, sir.
Okay, so that type of practical things, if you add some nutritive values by adding some Yashti Madhu. See, Yashti Madhu directly is, when I'm teaching my students, practically I tell them that theory it is mentioned in Agra Sangraniya Dravyas like Yajyapurushi and 25.
Yes,
chapter Sutrasthana, it is clearly told. I make them remember that it is a package of beauty parlor for girls because it is Chakshusha, Kanthya, Keshya, Varnya and what not. So like that formulations, if we tell only wheat and this thing, they will take in home only. So there will be no any medicinal value for that. So any nutrition product is there, it should be complete until you make it a formula and you bring it to the market after doing some. What is your PhD topic?
Yes, sir. That comparative study of Amalaki fortified biscuits in adolescents with iron deficiency anemia, sir.
Okay, it contains only Amlaki or any formulations you have in that?
Formulations, sir. From the Pathya Dravyas of anemia, I have collected the Yava, Mudga, Shali, Amalaki, and even I am adding Pipali for Agni Deepana and Agni Varthaka, sir. And for binding agent, and Grita, sir.
No any Loha Basma in that?
Yes, sir.
No any Loha Basma in that?
No, sir. Because sir, that's Ahara Dravya when we tell so long term use rehta sir. So that's why Loha Basma I am not adding, sir. And actually what we are expecting that if the Ahara Dravya is giving 50% of the result when compared to the Avishada Dravya, then Ahara Dravya is Sreshta. Like that I am going to define, sir.
Okay.
And along with medicines, if the dietary supplement is given, then that is having extra benefits, sir. On Agni also, on Coast also. So that extra benefits we can have, sir.
That is good.
Another I'm trying, sir, another UG research grant that I'm going to prepare a fiber rich product from the Pathya Dravyas from Anaha, Udavarta and Arsha Chikitsadhyaya. And I'm going to prepare a bar, sir. So both the products, I'm going to analyze the nutritive values so that frying or the cooking is see biscuits means we are cooking it in microwave, sir. So whether there will be nutritional loss, the nutrient loss, what are going to happen, and if we don't cook it, then what are the benefits? So I'm going to analyze, sir. So in this way I thought I can prepare the any nutritive products in the Trichology also for hair health also, sir. So that's just an idea what I thought, sir. Then next I'm going, I'll definitely going to prepare it and I'll do the nutritional analysis, and definitely I'll going to try it on the patient, sir.
Yeah, think twice before using microwaves because that may injure the patient's health also. Because nowadays they are not.
Yes, sir. Yes, sir. So we have other methods, so open cooking method also, sir, for biscuit preparations, not only microwave. So I have that other method preparation also, sir, in the open vessel. So directly closing the lid and preparing the biscuit, sir.
Okay, done.
Yes, sir. Thank you, sir. Thank you, sir and ma'am.
Thank you, Dr. Manjula Hekar. Thank you, judges. Now moving on to the next, that is 12th presentation by Dr. Swati Sheth, practitioner, Roganidana Evam Vikriti Vijnana, Government District Ayush Hospital, Udupi. Title of presentation is Understanding of Clinical Approach to Rakta Dushti Nidana, Whole System Research to Electrophoresis. Over to you, ma'am.
Am I audible?
Yes, ma'am, you're audible.
I'll share the slides. One second. The slide is not sharing. One second. Whether my slide is shared?
No, ma'am.
I think so. Something is giving. What about now? Is it shared?
No, ma'am, not it.
One second. Some error is going on here. Is it shared? Hello, can you please tell me whether the slides are shared?
No,
Hello?
ma'am. No, ma'am.
Can you please help me in sharing? Because something is happening here. I don't know. The slides are not getting shared. What about now? It's showing sharing here, but it's not displaying there.
No, ma'am, it's not shared yet.
Could you please help me in sharing? One second. Again, I'll stop it and share back.
We'll start with the next presentation. Can you present after that?
One second. Yeah, please start with next presentation so that I can just try it out here.
Okay, sure. Next presentation is by Dr. Shakuntala B.
Yeah, I think so. It's shared right now. Can you please see? No,
it's not shared.
Okay. You just please carry on with the next presentation. I'll present next.
Next presentation will be by Dr. Shakuntala B, Professor of Agada Tantra, SDM Trust Ayurvedic Medical College, Tadal. Presentation title is Ayurvedic Management of Karya.
Good afternoon, everyone.
Shall I share the slides?
Yes, ma'am.
Swati, may I still sharing the slides? So Swati should start the edition.
Swati Matre.
Even they are reading. Swati, they active in the problem now.
Is it visible, ma'am?
No, ma'am, it's not
Hello?
visible.
Is it so? One second.
Shall I try once?
Yes, ma'am.
Yeah, you can try. Okay, Dr. Swati, ma'am, you can present. Dr. Swati, are you there?
Madam, shall I try my presentation?
Yeah, please.
Hello.
Hello.
Madam, maybe we can continue even without presentations because it's already 2:15 now.
Ma'am,
Yes,
Namrata
ma'am.
ma'am, you are having my presentation. Can you please share me? Sorry for the interruption.
By the time we'll start with Dr. Hema's presentation, I think Dr. Swati's presentation is showing. I think you can proceed with your presentation, ma'am. Yes, Dr. Swati, you can proceed. Dr. Swati?
Am I audible now? Hello?
Yes, ma'am. Yes, ma'am, you're audible. You can
Can I
proceed with your
restart
presentation.
now?
Yeah.
Can I
Please.
restart now? Yes, thank you. तेजोरसानां सर्वेषां मनुजानां यदुच्यते पित्तः उष्मणः स रागेण रसो रक्तं रुच्यते. Ayurveda beautifully explains about ragata imparted by Ushma Guna in the pitta, in the rasadhatu, that which we can see. Myself, Dr. Swati Sheth, Medical Officer, District Government Hospital, Ajarkadu, Udupi. Today, my topic of presentation is understanding of clinical approach to Rakta Dushti Nidhana with special reference to electrophoresis. Hippocrates said that our food should be our medicine and our medicine should be our food. So we all know that during the Garbha Utpatti, Matraja, Pitraja, Rasada Bhavas are important for formation of Varna, and Rakta is very, very important for all the cosmetic problems as well. So cosmetology is not something which is rubbed, poured or sprinkled to enhance the beauty. Avoiding Rakta Dushti Nidana enhances the internal beauty along with the external beauty. We all know that the Rakta imparts Varnata, Snigdhata, Tamprata, which explains regarding the importance of Rakta, and Pancha Mahabhauta of the is also helpful in imparting different cosmetological problems, like increased Prithvi Guna increases the Gandhada, which causes the foul smell, increased Jalata increases perspiration, that is again a cosmetic problem. Similarly, increased Tejo Mahabhuta imparts Ragata. So there are different nidhanas like Lavana, Amla, Katu, Mamsa, Krodha, Madhya, Abhigata, all will cause different cosmetological problems as well. So let us understand Rakta Dushti. Atamina reduces, leading to the darkness of the skin. Similarly, skin allergy will also be caused by amla guna of the substances. Similarly, excess katurasa triggers the excess oil secretion, traps the dirt, leads to the acne, and excess lavana rasa leads to the wrinkle by increasing the sodium content, water loss in the face as well as causing the bags beneath the eyes. Similarly, intake intestinal enzyme which causes bad odor from the body. Similarly, abhigata in the form of sunburn or hyperpigmentation can also be seen as a Rakta Dushti Nidana. So Krodha is also one of the reason where it increased cortisol, increased blood sugar, leading to the thickness of the skin, appearance of the lines or wrinkles on the face. Excess madhya also leads to the acetaldehyde accumulation, leading to transient flushing of the skin as well. Now let us understand the practical approach of this Rakta Dushti Nidhana in clinical cosmetology. We all know that skin is hydrophilic, lipophilic, has a cutaneous flora, wherein natural pH is mildly acidic, and it has 3 layers, that is epidermis, hypodermis, and dermis. So what is electroporation? You all can see her picture wherein magnet is getting attracted towards the magnetic particles. So electroporation is a technique wherein electricity is applied to the cells so that skin will be permeable for the absorption of the contents whatever we are applied on the skin. So it's a non-invasive, which is a safe process, wherein, so what happens here is whenever you're applying the product through using the electric field, the products will be entered in between the cells and it gets trapped and thus creates a good effect. So we all know that we use different water, lotions, creams, etc., which requires more time for the absorption on the skin. So now the question arises whether the machines can be used by an Ayurveda doctor like electrophoresis. Definitely yes. Why not? We can use all transdermal and transepidermal. So to use this electrophoresis techniques, there are different indications like pigmentation, damage, skin acne, rosacea, lines, face sagging, stretch marks, cellulitis, etc. So how we have to treat this? One is through the passive method, one is through the active method. Passive method is application of the drugs over the skin surface, and active is through the machines, forcing the medicine to penetrate inside the skin by creating the gap with the help of electricity. So now let us understand classically. In Charaka Sutrasthana Aragvadi Adhyaya, different labels are mentioned, which does not speak only about the topical application, it also speaks about the transdermal drug delivery. So we all know that Abhyangam, Acharet, Nityam, which removes the jara from the skin. Here in Abhyanga, we use different techniques like velocity and thermal. In Sushruta Samhita also we get references regarding Matra Kala, wherein nullify the effect of jara, 900 Matra Kala of Abhyanga has to be performed. Hence, further more researches to be conducted to understand the Matra Kala with respect to modern science. So these are few of the modern innovations wherein ultrasound, velocity-based, electrical, thermal, different technologies are used to impart the medicine inside the skin. So take-home message, avoiding Rakta Dushti Nidanas in preventing the cosmetological conditions rather than only using external application. Following proper diet regimen promotes and enhances the beauty. Following the basic principles of Ayurveda in combination with the application of modern technology like electrophoresis in the field of cosmetology helps to enhance internal beauty through which external beauty is also enhanced. Thank you.
Thank you, Dr. Swati. Over to you, judges, for the further questions.
Dr. Swati, have you tried using any of these techniques?
Yes, ma'am, definitely. I've been practicing my cosmetological this all the treatments since 5 to 6 years, wherein I have noticed lots of differences by using the machine like electrophoresis machines. I use galvanic machines. I also use different other wand massages also, wherein I use my of the topical agents with the help of the gel, because we need a gel as a conducting agent here, wherein we use the gel along with the required product for the patient, that which helps to penetrate. I have certain other case studies also regarding this, wherein I have seen the effect on the patients also, ma'am.
So that should have been included in your study. Maybe rather than the basic concepts, you could have explained one case study also to improve the presentation. And you prepare the gel out of Ayurvedic medicines, or?
No, ma'am. Actually, what happens is we cannot prepare any gel out of Ayurveda medicines except the flax seeds. As per I have seen, except the flax seeds, we cannot do any other gels or something like that using any other natural things. So, but what we do is we use certain other chemicals which are not like gore gum. There is a gum called as gore gum, which we use to form the gel and which we certainly prepare to the patient immediately and we use it on the patient. Or else flax seeds can also.
You are not audible, Dr.
Swati. Hello, ma'am.
So,
am I audible now?
How then? Yes. In between, we have
yes, ma'am. Can I repeat the same thing, ma'am?
No, Dr. Swati, what I was interested to know is where is the role of Ayurvedic medicines with the how do you combine it with this procedure of electrophoresis?
Definitely, ma'am. Definitely. Let us consider a patient.
How is my question?
Yes, ma'am. Yeah. So what happens is, let us consider one case who is having a chubby cheeks. Okay. So wherein we can only with the external massages we cannot reach the dermal region. So to induce the drug inside the dermal region or to give an external boost for the collagen tissue, we have to use this procedures like electroporation, wherein which we can incorporate the medicines inside the dermal layer as well. So what happens is when we are using this kind of procedure, there will be a gap created between the cells so that the products.
Dr. Swati, my question is practically, how do you do it on the patients? I don't want to know the theory.
Yes,
you have used it, you're telling me, na?
Yes,
you apply the laper followed by electrophoresis, or you do the electrophoresis procedure and then immediately apply the laper. How do you do that?
Yes, ma'am. First of all, we used to clean the face properly. Then we apply the gel. Upon that, we apply the required medium. For example, Kumkumadi Taila, Eladi Taila, or whatever the drug we have to apply, we will apply it on the face of the skin. Then we on the electrophoresis machine, we set the time for the patient. We improve the intensity on the patient. Whatever the time intensity is required, 3 minutes, 5 minutes, 15 minutes, whatever is required, we will select that. Upon that, we just start rolling that instrument over the skin. So that after certain time, the time ends, we will just wipe off the things, whatever is applied on the skin. Then we ask the patient to apply certain laper on the skin. And this procedures will be repeated once in 21 days or once in 30 days.
Okay. And for how long does this procedure last?
This procedure lasts about for a month, ma'am. As I have seen,
it
lasts for one
sitting. Dr. Swati, one sitting, how long?
It takes hardly 30 minutes, ma'am. 30 to 40 minutes, depending upon the patient's condition or whatever procedures we are planning for.
Have you tried it? In what conditions have you tried it?
Ma'am, I have tried it in lots of conditions. Like one is in the condition wherein the patient had a chubby cheeks, wherein the patients had acne scars, wherein the patient had a pimple like acne are there. So after giving certain medication, when the acne are healed and all other procedures are done, in the last moment we can use all these treatments for healing purpose also.
Pigmentary disorders?
Pigmentary disorder, this will not give much result, ma'am, but still we can try because we go with the different electroporation massages here. So by applying the required medications, like for hypopigmentation, we have a lots of medications which we use. For example, we use Kumkumadi Taila, that too not in the oily patient. If a patient is not of oily skin, if he's a combination skin or a dry skin, then we can use this Kumkumadi Lepa and we can, Kumkumadi Taila with the help of the gel, and same procedures we can try it on the patient. But I don't think so in chronic cases this will give the result only by Kumkumadi Taila. We have to add on with other medications also.
Any other medication you have tried apart from these two Tailas that you are naming?
Yes, ma'am. I have tried Eladi Taila. I have tried Bala Lakshadi Taila. Bala Ashwagandhadi Taila. I have prepared my own formulations using Sariva Chandana and all. I use Chandana wherein the patient will complain about psychosomatic condition along with the skin problems. Only then I will go with the Chandana. So I have done certain formulation of my own wherein this kind of techniques will be used. And I have tried Jati Phala also, ma'am. So there is a reference in our classics also for that Jati Phala can be used for the Vyanga. So I have tried that, but result is not that. I think so. I have to do further more research on that topic.
So all this is in the Taila medium, isn't it?
Yes.
Alepa, following Alepa, you have not.
On Alepa, we cannot do electrophoresis, ma'am. Alepa should be done after the electrophoresis treatment.
Have you tried that? Electrophoresis with the natural gel followed by Alepa?
Yes, ma'am. I have tried with that Gorgam which I mentioned. I have tried with that because we use two medium for preparing the gel. One is Gorgam we use, and one more we use that is a chemical content which we use in the form. So that would serve the purpose because we do the intense treatment. Whenever the patient take prior appointment, previously we prepare the gels and we use the extracts of certain medicines like hibiscus.
What is your opinion on?
Yes,
what is your opinion on Beeswax?
Opinion on Beeswax, ma'am. Ma'am, there are two different types of beeswaxes. Like there is refined and unrefined. So if we are going with the natural form of unrefined wax, I think so we get also the reference of beeswax in our classic as Madhuchista. So I think so beeswax, if we are using a good quality with the unrefined variety of beeswax, that is natural. That gives natural coverage to the skin. But we have to know that whom to use the beeswax is very important. So when we are using the beeswax, we are not supposed to use much of the beeswax in the patient who are of oily skin. I always suggest using of the beeswax.
No, that is not my question, Dr. Swati. My question is than the gel for electrophoresis, can we use our medications in beeswax than oil?
No, ma'am. No, there should be certain other medium. Why? Because that will not rotate. That instrument will not rotate. For the easy flowing of that instrument, we have to use some gels.
When you heat the beeswax and make it into we prepare ointments using beeswax, isn't it?
Yes.
So in such forms, can we add our drugs and prepare such gel-based have you tried it?
Yes, ma'am. I have tried it. We can't.
What problems do you face?
Because it
is thick enough.
Beeswax will harden, and that momentum, whatever we have to achieve, that rotation, because while rotating that machine also there is certain angle that we have to process, wherein we have to move our hands, not the hands, we have to move our wrist. When we are moving that wrist in certain direction, if we are using beeswax, that will not give us a good result. Not allow us to rotate it in the way which we want to rotate.
So consistency matters there.
Yes,
that is what you want.
Definitely, yes. Consistency matters.
Good, Dr. Swati. A new hypothesis coming up today, with giving lots of ideas, research ideas in a new field. Congrats.
Thank you so much, ma'am. Thank you so much, ma'am.
Sanjay sir, over to you.
Yes, ma'am. Thank you. Yeah. Much is discussed, Dr. Swati. I just wanted to know.
Yes, sir.
Are there any disadvantages of this one? Are we harming the skin cells, or are there any major side effects for this process if you do like this?
Sir, as of now, since 5-6 years, I'm practicing on the same technologies, wherein I have not found any side effects as such. But we have to be very cautious when to use this, apply the machine, and when not to apply. So rather than side effects, we being practitioners or we being the cosmetologists, we have to know where we have to use this. For example, if a patient is having HIV, or if a patient is having some other acne which are in the first stage. So that are the things. Side effects as such, I have not seen anything, sir. But rather than side effects, we have to take precautions while using these machines. That is my opinion, sir.
To whom and when to take precautions? What are the conditions to be considered before you plan for electrophoresis? So which patients you want to avoid?
Yes, sir. Sir, to use this machine to the patient who are having acne and active acne or active skin infections, or we are not supposed to use
Our customized cosmetic products will be
wounds, or if a patient is having if a patient is taking blood thinners, or if a patient is having any other allergic conditions, or if a patient is scared, or if he's having a mental condition. In all such conditions, we are not supposed to use electrophoresis treatments, because we are using current here. That is the thing wherein we should be very cautious regarding everything, and we should not keep any other metal with us. We have to ask the patient to remove all the metals like earrings, nose pin, whatever is there. No, we have to ask the patient to remove, and we have to do these procedures, and we have to be in we have to take certain other safety precautions also before going with all these procedures.
Okay, done. One last point. Be brief in that.
Yes, sir.
Answer briefly. How do you find the difference between electrophoresis with Ayurveda and Ayurveda alone?
Sir, yes, Ayurveda is a wonderful science wherein we have lots of drugs mentioned in this. Now these modern technologies are going on, and we have to inculcate all those modern technologies inside with the help of Ayurveda. With the help of Ayurveda, we have to take the new innovations as such. So we have lots of drugs. With the help of these machines, we get better results, more results. It is not that Ayurveda will not give the like we are applying the any of the creams or something on the face because it's water and oil emulsions. Let us think that it will give result in 1 month, but along with this machine, if we are using, it might give us the result within 15 days. So the time duration of the applied product will be very less if we are using along with the machine treatments.
Okay, done. Good thing.
Sir. Thank you so much, sir.
Thank you, Dr. Swati, and thank you, judges. Moving on to the next presentation by Dr. Shakuntala B., SDM's Trust, Ayurveda Medical College. She is a professor of Agada Tantra from Ayurvedic Management of Kalitya is the presentation title.
Good afternoon, one and all. Myself, Dr. Shakuntala from SDM Ayurvedic Medical College, Tirdal. Introduction. Hair speaks the age of health of an individual. Hair plays an important role in making body externally beautiful and also contributes to a person's positive attitude and physical well-being. But in the present era, due to the change in the lifestyle, health condition, poor diet, certain drugs, pollution, thus there is hair fall. In Ayurveda, Kalitya means hair fall. According to modern science, it is termed as alopecia or baldness. It is a partial or complete hair loss of hair, especially from the scalp. Baldness is a curse for one's look and personality. Common hair fall condition is in the present day is being seen in male, that is 40% in male and 25% in the female. And it is in youngest age, that is in between 18 to 40 years. Coming for the historical review. So we come across the references of Kalitya since from the Vedic period only. So in the Atharva Veda, we come across the case of Rishi Jamadagni, who was able to enhance the hair growth of his daughter, and with the use of the Viruddha Dravya sources like Nitani and Keshab Vardini, like that. In Garuda Purana also, we come across the references that the Nidana for the Kalitya is Teja. And in Charaka Samhita, in Trimarmiya Chikitsa Adhyaya, we come across the Kalitya, and in Shushruta Samhita, in Kshudra Roga, and in Samgraha Kala, in Astanga Sangraha, we come across under the heading of the Kapala Vyadhi. In Astanga Rudaya, Shiro Roga Vijnana, and in Madhava Nidana, we come across the Kalitya in Kshudra Roga. And coming for the Nidana, so here, excess use of the lavana and kshariya dravyas, uses of viruddha ahara, and ignorance of the pratishaya. Actually, it has been told as a Kalitya is one of the complication of the pratishaya, and we see in Astanga Rudaya that for each wherein Kalitya is been included in the Shiro Roga, and for all the Shirogata Roga, the Samanya Nidana is being told. That is a Duma, Atapa, Tushara. Tushara means the snow, means the much use of the cold water, and Adhika Jala Krida, then Divaswapna, and Utsveda. Atya Utsveda means more sweating. So more sweating is due to the over exercise also, and even in the calcium deficiency also there will be more sveda. So here when there is a excessive sweating, there may be infection of fungal or bacterial infection, and due to the manoroga, and the person upadana mruja means using high pillow for the sleep during the sleep. And nowadays when we are going to compare all these things, so here we are seeing the poor diet. The poor diet means restricted diet the persons are going to have. And nowadays there is a fashion of going for the gym, wherein attending gym, maintaining strict diet, and also having more rich protein. This for the protein there will be metabolism, and due to this there will be increase of the body heat. So this is going to the main causative factor for the Kalitya is the Tejas. When Tejas is going to increase along with the Vata, it is going to deform the hair follicles. So here more intake of the water. When there is a more intake of the water, there will be flushing of the nutrients also. Next slide. So coming for the Rupa, so prime for all the common sign is hair fall, but according to Ashtang Charakachara, he has included the 4 types of Kalitya, that is Vataja, Pittaja, Kafaja, and Sannipataja. So in Vataja, we see the Rukshata, and also there will be Aruna Varna, and in Pitta, there will be Shira and Rakta Varna, and in Kafaja, the Kafaja it becomes white, and the scalp becomes very hard, and in Tridoshaja, there will be mix of all the doshas. Next slide, please. So coming for the Gati means Nidana. Nidana Sevana. Due to the Nidana Sevana, there will be Visheshan of the doshas. That is the Pitta, Prakopa is going to occur. That is a Tejas, which has been told the Nidana for the Kalitya. And along with the Tejas, the Vata, and it enters the Roma Kupa, and there will be Roma Shatana. And that place with the Rakta and further Kafa Dushti, it is going to accumulate, and it is going to do Shiramukha Avaroda. So here it is going to cause a Kalitya. Next slide, please. So what's our duty is that the Nidana Parivarjana is a must, because when we in the initial stage, when we are going to do this, avoid this Nidana, much of the symptoms will be relieved. And the next one is the Shodhana and Shamana Chikisa. In Shamana Chikisa, after the Shodhana, Rasayana is being told, and Abhyanga and Lepa and Yoga is also being told. So here in the Panchakarma treatment, So Vamana Virechana Nasha is been told, and initially for the hair fall, and after that for the if there is more involvement, means in alopecia areata, we see that there is a
Dr. Sulochana. Judges.
Dr. Sulochana, practically, what would you advise to your patients? Hello.
Dr. Shakuntala, please unmute yourself.
Okay, ma'am. Okay. In the initial stage, if the patient is going to come means, so during that time, Nidana Parivarjana is been told, and Vamana Virechana is been advised along with the Nasha. Then Pratimada Nasha is, that is Anitya Nasha treatment with the Anutaila is been advised. And if there is the area is bit larger, means the Jaloka Charana is been done and the Prachanna is been done. So Prachanna, there's with the Garshana of the leaves like Tejapatra or Kako Udumbaradi Patra, the Garshana is been done, and over that Gunja crushed seed, one Gunja crushed seed is been soaked in takra overnight, and next day it is been washed with the water. Again it is been saturated with the keratailam, that is a coconut oil, and gradually it is been applied. Or very thin layer is been applied for 2 to 3 minutes. Initially I am going to apply it for only 1 minute, and afterwards the next 2 days I am going to apply for 2 to 3 minutes. So when the boils are going to come, so during that time we have to wash it with the Triphala and apply Shatadauta Gruta. After that, the lepa of Madhukadi lepa is been done. Madhukadi means ST Madhu, then Draksha, honey and ghee. With that, the application is been done. It acts as a rasayana, and gradually there is a mild hair growth, ma'am. When there is a follicle damage, means totally the follicles are obstructed, during that time we can do this Prachana and Jaloka Charana.
What is the cause of this follicle damage? In all cases of Kalitya, you use this?
No, ma'am. Where there is a total, means the area when we are going to see through the trichoscopy, when there is a more area is been, means the hair and there the hairs are there, means during that time we are going to do the Prachanna and Gunja Lepa.
If not
with the Shamanaushadis and also with the Tailas, we are managing, ma'am. Initially, as there is a visheshan of the dosha, Vamana and Virechana should be done, and afterwards the line of treatment is going to start.
Do you suggest both Vamana and Virechana to patients of
initially, if the patient is willing, means we can. Otherwise, Virechana can be done, and Nitya Virechana can be given with the Triphala or with the Avipatti Churna, or even Patola Katurvainadi Kashar tablets.
Nitya Virechana, what is the number of Vegas you expect?
1 to 2 Vegas, ma'am.
Then just Anulomana is your expectation.
Yes, ma'am. Anulomana is my expectation.
Have you treated any patients of?
Yes, ma'am. I have treated two patients. With the Gunja Lepa, I have tried. There was
Have you heard of lichen planus producing Kalitya?
In that, it will be just like a Dagdva, means totally there will be in the form of burnt only. The skin totally, it will be in the shiny, glittery form.
Totalis, the whole of this skull.
No, ma'am. Not in the lichen planus.
Circular patches.
Circular patches.
In such cases, in such circular patches, the same application, do you think it will work on?
Madam, I have tried one patient with the leech and one patient with the Gunja Lepa.
Okay. Thank you, Dr. Shakul. Sir, over to you. Sanjay sir.
Yes, ma'am. Thank you. Good presentation and more practical things, Dr. Shakuntala. Congrats for that.
Thank you, ma'am. Thank you,
And
sir.
so I have just one doubt that if you are using this trichometer and all,
sir.
Have you been trained officially in this?
No, sir. Just curiosity only. I have not been trained, sir.
Then how could you make a diagnosis out of curiosity? Self-learned or any experts have been given, like a dermatologist? Are you taking any help of dermatologist?
No, sir. Actually, once we were having the seminar in our college, so we called upon the dermatologist. Just he showed us. So I took the help of that person only and I have it.
So Prachana Karma with what? With needle you are doing?
No, sir. Prachana Karma with the Garshaka Patra, Tega Patra have took and I have done the Garshana, sir. With the needle also it can be done, sir. But just I have tried with the actually
Tejapatra is it so hard? Tejapatra can do Prachana?
Yes, sir. Yes, sir.
Are you talking Gojiva or Tejapatra?
Tejapatra, sir.
The same thing what we use as a spice?
Yes, sir.
Okay, because people do with Gojiva Patra or else with
sir. Yes, sir. Just it was available with me. Just I have done, and it was a very slight abrasion means. But over that I have applied Gunja Lepa. Only one seed I have taken, and I have crushed and kept it whole night in takra. Next day I have washed it, and then with the tail, that is coconut water, plain coconut tail, I have triturated and done lepa.
So just Gunja, nothing else?
Nothing else, sir.
Okay. Okay, done. Thank you.
Thank you, sir. Thank you very much.
Thank you, Dr. Shakuntala, and thank you, judges. Moving on to the last presentation by Dr. Hema Sundari, Professor Ayurveda Samhita and Siddhanta from SJG Ayurveda Medical College, Koppal. Title of presentation is Contributions of Balaprabodhika Commentary in Varnotpatti.
Good morning. Good afternoon, everyone. Is my presentation visible?
Yes, ma'am.
Okay. Thank you. The title of my presentation is Contributions of Balaprabodhika Commentary in Varnotpatti. Garbhasamskara is an ancient methodology described in Ayurveda for a desired child. To deliver a child with excellent qualities and desired features, a couple should possess Avyapanna Shukrashonita and the Garbhashaya. Objectives: to describe about various ahara in different months of gestation for particular Varnotpatti. The commentaries which I taken for the study are Sarvanga Sundara, Ayurveda Rasayana, Vignayartha Prakashika, and Bala Prabodhika. This is a sample copy of the Bala Prabodhika commentary where the Ahara Visesha are explained. Bala Prabodhika, am I audible, sir?
You are audible, ma'am.
Yes, you are.
Okay. Bala Prabodhika is an unpublished single manuscript available on Astangradaya Sharirasthana. I procured this manuscript from Oriental Research Institute, Mysuru. It total contains 1 or 2 folios, and on both sides of the palm leaves that it was written. It is written in Sanskrit language and documented in Telugu language. The script was in Telugu language, but the language it is in Sanskrit. The name, age period, or the author or the scribe details were not mentioned. For this presentation, I have taken the content from Garbhavakranti Sharira Adhyaya from 19, 20, and 21st folios of the manuscript. It was described here that a female who wished to deliver Gauras Shishu, she should take Shira Madura Ahara and she should follow the Udaka Vihara for the Gauravarana Shishu. And if she wished to deliver a Shamavarana Putra or the Shamavarana Shishu, the Tila or the Krishna Varana of the Ahara is contributing for the Shama Varna for the Shishu. And there are total 4 factors mentioned which are influencing the Varna. Those are Mata, Pita, Desha, and the Kala. And there is one more point explained here. Due to the Gaura Varna of the Shukra, a child will be similar to the father, and due to the Krishna Varna of the Artava, the child may be similar to the mother in the features. And Panchabodhika combination for the Varna Utpatti, Gaura Varna, it is contributed due to Udaka Akasha Tejo Mahabhuta, and Shama Varna due to Prithvi and Vayu Mahabhuta.
Slides are not moving, ma'am. Please move the slides.
Sir,
She can give better expression than this. It looks like artificial. It's not natural. That's what I'm saying. अभी जो natural दे रहे हैं ना वो उधर नहीं दे रहे हैं. This is good. This is also good. This is natural. The upload. Catching to the. Telling me. Right, I'm so bad at content.
Dr. Sharad,
Yes, sir.
I think Madam has left the meeting.
So she'll be joining. There's some technical issue. We'll wait for 2 minutes. She joins, sir.
hello. Sorry for the interruption, judges. Hello. Hello.
Yes, ma'am. You're audible, ma'am. Please share your
Sir,
screen.
can I represent, sir? Hello.
Yes, madam. Yes, madam.
Can I represent, sir? Thank you, sir.
Yes,
Thank
ma'am.
you for the
Share.
opportunity.
And right from the beginning?
Yes, sir. Sir, whether my slides are visible, sir?
No, ma'am.
My slides are not visible, sir. Yes, sir.
No, ma'am. Not yet.
One second. Sir, whether all the slides are visible, sir?
Slides are visible,
Hello.
ma'am, but please move it and check once whether.
Okay, sir. All the slides visible. Okay, sir. Okay, sir. The title of my presentation is
Ma'am,
Contributions of
please continue
Balaprabodhika
from where you have left, ma'am.
Okay, sir. Okay. If we, it was described in the commentary that a female who wished to deliver a Gauraputra should take the Sweta Dhanya with the Sarpi either for the 7 days or the 12 days. Sweta Bunjana Pradame Masi Sweta Dhanya Sasarpisha Saptaham Dwadasaham Va Gauram Putram Prasuyate. In the second month, it was advised for a female who wished to deliver a Pita Putra should consume Pita Dhanya with the Sarpi for a period of 7 days or the 12 days. If a female who wished to deliver a Shama Varana Putra should consume Shama Dhanya with the Sarpi in the third month for the period of 7 days or the 12 days. And A female who wishes to deliver a Krishna Varana Putra should consume Krishna Dhanya with the Satvi for 7 days or the 12 days, and in the 4th month. And if a female who wishes to deliver a Kanya with the Gaura Varana should consume Shweta Dhanya Yavagu for 7 days or 12 days in the 5th month. In the 6th month, it was advised to take Odana, Mamsa, and the Sarpi to deliver charming children. In the 7th month, consuming of Shali Anna with the Kshira Sarpi enhances Ayu, Varna, and the Bala. It was mentioned that a female who consumes Bala Tittira, Aineya, Kapota, Shasha, Barhimamsa in the 8th month will deliver attractive or beautiful children. Discussion. As per Charaka Samhita, the Swaravarna Sampat and the Bija Sampat are included under Satmaja Bhava and Atmaja Bhava. But Chakrapani clearly mentioned that the Varna is influenced by Rasaja Bhava as well. Prior to the conception, if male or female who follows the Apatya Sevana will lead to the Dusti of Artava or the Shukra, and which influences the Dusti or which influences the Garbha also. These are the following factors which influences or which plays a major role or which contributes a variation in the samsthana, varna or the indriya vikriti or the variations. Those are the bija, shukra and the shonita, garbhashaya, ahara vihara, kala and the atma karma. Conclusion. Purushoyam Loka Samvitaha. As per Loka Purusha Samya Siddhanta and Samanya Visesha Siddhanta, like Raktam Raktena Vardate, Mamsam Mamsena Vardate, our human body is a replica of the whole universe. Yavanto hi loke murtimanto bhava visesha tavantak purushe. Yavantak purushe tavanto loke iti. So I am here to conclude that the varna of the matru ahara in the gestation plays a major role in the varnotpatti of the fetus. Thank you.
Thank you, ma'am. Over to judges. Hello.
Hello, sir.
Yeah, now your slides are visible because if you make a full screen, sometimes it is not visible.
Okay, sir.
In your conclusion,
sir.
The last sentence, Varna of the Matrahara in the gestation plays a major role in Varnopati of the fetus.
Yes.
Is it conclusive or hypothetical?
It is hypothetical, sir, because a lot of research is yet to be done on this topic because it's an unexplored part of the manuscript and which we are not getting in any other commentaries or the in the classicals or the references regarding this. Masanamasika Garbhini Parichay, etc. were described, but nowhere regarding the Varna, which type of ahara and in which month it was not described at it. So this is my area of interest of manuscriptology, where I got this reference of like Masanumasika or how the ahar is influencing, but a lot of research we should go through this, sir.
So even the color of the grains or the color of the food what the lady is taking during pregnancy.
Yes, sir.
If we go with the text and if we try to present it in front of the modern world, they will definitely reject it, saying that it is not scientific because in majority of the racial like the places like African countries and all.
Yes.
Even if they take milk and ghee every day, milk, curd, etc. every day, we cannot expect the child to be born with fair complexion, right?
Yes, sir. That only I mentioned in the discussion part, sir. There are so many factors which are influencing the Varna, like Mata Pita, Desha, Kala, and even the Garbhashaya, Prakriti, Ahara, Vihara. A lot of things are there behind the Varnotpatti. This is one such an aspect. A couple who are having the Avyapanna Bija and the Garbhashaya, if they are practicing the methods which are followed, which are advised in the Garbha Samskara, we may likely to achieve that the desired child, sir. It is not only the ahara which will decide the varna. That's why I mentioned in the previous slides. So that one.
Yeah, but what I feel is you should have taken this point as just one point of some other topic because the major topic itself, this one, doesn't play a good role here. For example, If Matraja, Pitraja, Rasaja, etc. is there, then Bija dosha is there. If what we call the
Sir,
familial.
my topic, sir,
Yeah.
sorry for interrupting. My topic is comes under Shastrartha, and I'm working on the manuscriptology. This is the only one manuscript which is available in Ashtanga Sharirasthana out of the 34 cited by the Yadavji Trikamji. This is the Balaprabodhika commentary. Till now, it is comes under unpublished one. So
Is
I've
it
taken
your PhD
purely
topic?
from the Shastrartha, sir. Sir, pardon?
Is it your PhD topic?
Yes, sir. This is my PhD topic.
What is the title of the PhD topic?
My PhD topic is Critical Review on the Balaprabodhika Commentary on Ashtanga Sharirasthana.
Okay. Okay. No, that commentary, if you are working, then it's fine. But if you are if you are presenting on a concepts like the embryology, there are many other texts also which throw some light on the factors responsible for the creation of organs and skin, etc. Like Garbhopanishad.
Yes.
There is one Upanishad called as
Yes,
Garbhopanishad.
sir. Yes, sir.
So there also it is there, and even in Sangeeta Ratnakara, in Hindustani classical text also, the first chapter goes on completely on the Garbha formation.
Yes, sir.
And also Swara formation, Saptadhatu, Saptaswaras like that. So, anyways, interesting, but
This is mine is only purely conceptual only, sir, because
yeah,
it's an
understood.
unexplored because this is only one copy is available that too in the Mysore.
Yeah, totally understood. It's a literary,
Yes,
no problem.
it is completely literary contribution to the Varnotpatti. A lot of researchers can be framed from this concept, sir.
Okay. Go to ma'am. Yeah.
Thank you, sir. Dr. Hema, I was interested to know maybe you could have enhanced the scientific approach of this paper now because we understand you are into manuscriptology, but then the topic you have taken is specifically on Varna, isn't it?
Yes,
sir. So, do you have references that Ahara play a role? Scientific researchers already, though not this Ahara, this set of Ahara, the food that a woman takes during her pregnancy period that has effect on the skin of the or the color, the texture and color of the skin of a baby. Do you have such references? Have you searched for such references?
Ma'am, my topic is contributions of Bala Prabodhika commentary in Varnotpatti, but still I worked and searched some of the research papers, but I got such a research papers, etc., where the description of various practices followed in the different parts of the India I got, like consumption of the kesar with the milk in the early months of the pregnancy, and avoiding the ahara which are black or the which are dark in varna like jambu, etc., avoiding those ahara which are dark in complexion. Maybe that was it was a practice in all over the India, and not only India, in some other parts of the world also, avoiding the ahara which are dark complexion, if the hypothesis that it may affect the varna of the kid, but there are no clear cut researches available.
Relation between melanocytes and food?
No, madam. Because
melanin component and food.
Yes, ma'am. As we can see, like consumption of the carrots, etc., it will like carotene, etc., component will enhance the little bit complexion. But we are not sure that it will completely turn over the prakrita varna. The prakrita varna is decided by many factors, like it may be the desha, kala, bija, or the race the people belongs to. It is not about the whole varna utpatti, but I here try to deliver what are the unhidden concepts of the commentary which not yet explained even in the Brihatrayi. But I gone through them, but I not got any such references regarding the particular ahara is going to affect like that. The clear cut the research was not done, madam. Not yet, I not yet found that such a research papers as of now.
Okay, Dr.
Thank you.
Thank you, Dr. Hema. So now we are in the end of the session. So I would like to request our judges to say opinion about the whole session. So over to Dr. Shobha Bhatt, madam.
Thank you, Dr. Sharad, for having invited me to this very well organized session. It's almost 4 hours now we are sitting together, and a Sunday, making us work on a Sunday, only Sharad can do this. So it was a beautifully arranged webinar. Today, I really am happy for being a part of it because this is in the name of our guru, Dr. Srinivas Acharya sir, who has taught us the clinical relevance of each and every concept that we speak, that we learn, and every word that he spoke was somewhere related to his patients, and he was as well very strong in theory, but then he always inculcated in all his students the love for the clinical approach for his patients. So, in his name, I'm so happy that you people have organized this national level seminar, and I really am more than happy to be a part of this. So, I thank you, Dr. Sharad, for having invited me, and it was very nice listening to all the teachers. In fact, today it was not just PG scholars, but it was teachers who were presenting, and several new concepts, hypotheses have come up. But there are lots of lacuna which we need to address. We are far behind and we need to cope up well so that we meet the present challenges in this world. Ayurveda is gaining huge popularity as well, and there are lots of demand from public and the modern counterparts. So we need to be very our thoughts should be open up and research oriented so that we can answer people from outside, even laymen also. In that scenario, the topic that was selected and the way the teachers have presented, I'm sure they would have taken back. And I was very happy that a question answer session for every teacher was organized, every presenter in that matter. And it was more, I am more than happy and excited to be a colleague of Dr. to be helping Dr. Sanjay sir. It was very nice working with you, sir, today. And I really enjoyed this session. Thank you for the opportunity. Thank you.
Thank you, ma'am. So now I request Dr. Sanjay Kadlimatti sir to share his opinion on the session.
Yeah, thank you, Dr. Sharad. It was nice to hear ma'am talking about this, and obviously, uh, frankly speaking, today I got some emergency work, and for the first half, 1 hour or 1.5 hour, I was on driving, and as well as I was coordinating the sessions. And yeah, Aptas, as ma'am said, even though I was not a direct student of Dr. Srinivas Acharya sir, but I always have this cherishable golden memories that whenever he used to come to Jamnagar, my guru Chandola sir, who was my guide also for PhD, he always used to say that whenever he comes, being from Karnataka, he should be the coordinator until he leaves Jamnagar, so that his daily routine, his stay, his food, his lunch, etc., should be taken care of. So from 2007 to 2009, he visited Jamnagar 3 times, and I was fortunate enough to spend entire days with him, along with very valuable discussions and all. So we had a very cordial relation, even though I'm not a student of Udupi, but it was my I can say Punya Karma that I spent some valuable days with him in Jamnagar, taking care of him for the whole time, and also dropping him to airport, etc. So I really congratulate Aptas for conducting an international conference in the golden memory of revered Guru Acharya sir, who always lives in the hearts of his students as well as well-wishers, because the real Guru never leaves this world, and his teachings are always with us. He used to inspire us with his wonderful animated presentations. We all remember, because he never used to make PowerPoints. He used to make animated presentations, and he was very good in technology. His concepts are excellent, amazing. And today also, coming to this today's presentations, all teachers, as I said, that we expect more higher level of quality of presentations when they are teachers who are experienced for 8 years, 10 years, or 9 years, like that. But still, we need to do a lot of work to be competent enough to be surviving this world. And many new concepts were there for electrophoresis, trichosis, etc. All these new concepts were there, and a couple of presentations are really good and competent enough. And also, I enjoyed working with Dr. Shubha ma'am. And congratulations to Aptas for this wonderful session. Thank you very much.
Thank you so much, sir, for your opinion. As an organizer, we have decided initially that because recently when I visited so many national level seminars, there were no questions being asked, and for the sake of completion of the sessions, they used to finish everything in hurry, and this has become a trend. And as an organizer, we Aptas have decided that we have to break this trend and we have to bring back the old method where there will be a discussion where generally there should be a Tadvidya Sambhasha. And today is the such a nice session happened, and both the judges have supported so nicely by asking questions, and I think this would have helped all the faculties also. So with thanking Dr. Shobha Bhatt Madam from BHU as well as Dr. Sanjay Kadlimatti Sir, Principal BLDA College Bijapur. So we Aptas thank both of you wholeheartedly, sir. And also I thank the coordinator of the session, Dr. Siddhanagoda Sir, Associate Professor from Sindagi Shantavireshwara Ayurveda Mahavidyalaya, Haveri. And I also thank the moderator of the whole session, Dr. Namrata, working as first year postgraduate student in SDM College of Ayurveda Hassan in Department of Manasa. So I also thank all the faculties who patiently attended the session as well as presented their views. So with these words, I conclude the session. Thank you one and all.